lured into homosexuality, which is one of the worst things that can happen to the youth. It's very unfortunate. Homosexuality is definitely a negative thing, although it is being glorified by Western countries. But I'm here to tell you today that homosexuality is very, very negative. I think you must have heard about the DSM, what we mean by the Diagnostic Statistical Manual of Mental Illnesses. DSM-3 had homosexuality as a mental illness, and from DSM-3 upwards, it was removed from the list of mental disorders. So another problem that is impinging on the youth is the mental illness of parents. Some of the parents are unstable, and you know that if the parents are mentally ill, they also produce mentally ill children. Family problems, because of the environment, some of the families are not stable, and this is also impinging on the youth. We have the death of family members in Uganda because of the pandemics. We have seen the death of many of our parents and colleagues, and this is impinging on our mental health. Bullying in schools. I understand schools also presented here. Bullying in schools also affects the mental health. Academic issues. Very, very serious stressors. Academic issues. Very, very serious. Serious stressors. Whether you pass or fail, whether you have no more progress, interaction with colleagues at the university, interaction with colleagues in the education system.
Still, all these are jobs and everything, but you can never empower a young person when they are not mentally okay. So we decided to change with the support of our mama, the First Lady, who is our patron. We managed to tackle into mental health. So we've done a lot of work in regards to creating the awareness, and we are still doing. We want to thank Makerere University for giving us this opportunity to start from here, as we are going to go to all the public universities. We're just the mandate, and being in the corporate world and knowing what everyone goes through, they really took up this the moral support. I always come to you, and you challenge me a lot. We've literally gone through the same kind of life, and we're here. I want to thank Richard Hand. I want to thank Rocket Health. Rocket Health also just came because we are trying. She really reached out. She prayed for me, she preached to me, she She took me through a phase, even when I remember when suicidal, I'm sorry, I've never, parents have abandoned their children. If there's any parent here, you need to take care of your children. The children who are in school are not okay. I'll be honest with you. Kids are packed by work they missed in 2 years. Kids have a lot of things that they went through during the pandemic when they were home. We go there, even as we get overwhelmed, we just leave them with clubs. There's a club we started in schools called the Ignite Club. It's a mental health club where they meet every Wednesday and share the word of God. They pray for each other. Like they keep together. So if there's a parent here and you have a child in school, reach out to your child. If it's visitation day, even if it's not a visitation day, get time, go to school, check on your kid, talk to them, open up with them, because it's not an easy world up there. So with all that I've said, I want to thank everyone once again. I don't know how I can thank the First Lady, because I know right now she's watching me. But on a serious note, I want to thank, now the camera should look in me. I am done crying. Ken, the camera is looking in me? Yeah. Mama, I want to thank you so much. You saw me, tiny me, in 2020, towards the end, and you believed in me. You sent me out to go and spread the word, and I'm doing it. I want to thank you so much with your office, and Madam Irene. I know Madam Irene is coming here. She's always bringing the message. I want to thank you with the whole office for helping us. We wouldn't have done this by our own power, but by your support, your prayers, and your belief in the young people of this nation. I want to thank you so much, and we are going to spread the news. And thank you so much for passing that order for every school to have a therapist. We want to thank you so much for that. Thank you so much, Mama. Once again, thank you so much, Makerere University. Thank you so much, Skills Clinic, Ministry of Health, AMREF. I think Dr. Patrick is coming, Krusi, the country manager. He's been a very key person in teaching us and motivating us into this kind of work, because God just sent us and we just decided to move. Thank you so much, Honorable, for honoring our invitation. We really love you. Thank you so much, Uganda Counseling Association, Rocket Health, once again, Kubamba. When you get people who don't live they don't live in the country, but they just see your work and they want it and they support you, it's really a big plus. We want to thank those people of Kubamba. They have a slogan, representing Christ to the fullest. It's a Christian organization that is based in Nairobi. Thank you so much, Nkatha. This lady here, first stand up, I can't live without saying hi to her. This lady here has flown all the way from Kenya, and she came specifically for this. Tukule is going borders. I believe God really sent us for this. She has organized a very big summit that is happening in November in Nairobi, and we are pleased to be part of it as the organization. And thank you so much, Mwenda. She has a name which is like a Ugandan name. She's called Nkatha Mwenda. She'll talk more about herself. She's the founder of Grace Youth Recovery Center. She's a lived experience of a very big addiction, so she'll share more she's one of our speakers today. Thank you so much, Katha. Thank you so much, Sams. These people are going to give us snacks today. So they are here. Don't worry, you're going to be fed. Thank you so much, One Hope. Gabriel, he sent his representative, Daniel. Thank you so much for actually believing in us. The material you give us that we take to schools is really helping the young people out there. Thank you so much, NBS, and Reach a Hand, and more importantly, Exim Bank. Thank you so much. I want to also acknowledge and honor my father who prays for me every day. He stayed as my father in the spirit. Prince Nick Nyombi. That man there, everyone that sees me walking until they see me with him, they'll be like, we didn't know that you submit under someone. But for us who believe in the word, you always have to have a cover. That man there is a father that I didn't see coming, but he became a father. He has really motivated me, he has prayed for me, and we've been in hard times together. We do gospel music awards. We acknowledge top gospel artists, so we work with him. Thank you so much, everyone. Thank you so much. I can't, if I'm to say names, I can finish everyone by name here. Auntie Lindsay, God bless you. God is giving me mothers. I have another mother here, Mama Jole Kajira. That one is special order from heaven. Special order. That is another mother of mine. People think, when they look at me, they say, you come from there, so they think she's my real mother. So thank you so much, everyone, for coming. God bless you, for God and my country.
Thank you so much, the Executive Director, Tukule Foundation, for the remarks and a lot that you have shared. Once again, I would love to welcome everyone to the Mental Health Summit on the theme, Renewed Hope, addressing the mental health challenges, basically, for the youth. I must say that we acknowledge everyone. We acknowledge students from Makerere University. We acknowledge also students from different universities. We also acknowledge our partners who have really made the summit a success. And also, we recognize the arrival and the presence of our speakers. Ladies and gentlemen, I would love to say that mental health has really taken a toll in every community. Of course, it doesn't segregate who you are, maybe where you're from. So it's really something that we need to tackle right from the grassroots or at the point where we are. First of all, I would again thank Makerere University for actually partnering with the Tukule Foundation, of course with the support from the Office of the First Lady, for really bringing such an event to the young people tonight. Once again, I would love to say my name is Lotiang Elia, and I am part of the moderation tonight. And as we go with the next program, I think all the partners have been introduced and thanked. At this juncture, I would also love to thank the Safe Places. This is a treatment center for a number of mental health services or a number of mental health challenges. Safe Places, thank you so much for being part of the summit. We go to the next program, that is the panel discussion. I am aware that we all have, we have all the panelists in the summit. At this juncture, I must tell you that the panelists were considered basing on their experience and their expertise in addressing the issues as far as mental health is concerned. I think before I invite the panelists, I would love to thank Dr. Henry Msubuga. He has been my mentor for the 5 years I've been in Makerere University. I must say that I'm a proud veterinary doctor because I would always reach to his office. Thank you so much, Henry Msubuga, for really giving me that hope, because I had answers to questions. Where am I going? What is life about? Who am I today? What will I be tomorrow? So I got answers through him, and thank God for that. It was paramount to thank him. We have the panelists. We have Dr. Nekesa Evelyn. As I invite our panelists, I think I also request the panelists to take the panel seats, starting with Dr. Nekesa Mary Jashinta, who is a counselor at the Counseling and the Guidance Center, Makerere University. He's also a lecturer at the School of Psychology, Makerere University. Dr. Nekesa Mary Jashinta, you're welcome to the panel discussion. Thank you. As well, allow me invite Evelyn Coney, who is also a counselor in the Counseling and the Guidance Center, Makerere University. And they have offered immense support mostly to the students and also the young people across the country. Thank you. As well, I would love to invite Sharon Kesabu, who is a psychiatrist and also a mental health advocate in the country. Last but not least, I would love to welcome Mr. Douglas Luanga. I think I have a lot to tell about Mr. Douglas Luanga, but you would really help me say that shortly is the founder of the Skills Clinic, which has really transformed a number of lives in this country, most especially when it comes to the young people. Ladies and gentlemen, those are the panelists we have tonight, and they will have a time to introduce themselves and talk about them, and then finally it will be followed by the questions, which would be moderated by the moderators. That is me, myself, and Inembabazi Rona. So I would love to ask the microphone to be brought, I think. All right. We can have the seats for the moderators. We can have the seats for the moderators on stage. So as the seats are coming, allow me welcome our panelists who would introduce themselves, talk about themselves, and talk about the services that they offer. Thank you so much. Starting with Dr. Nekesa Mary Jashinta. Welcome.
Good morning. So, as you have already heard, I'm Dr. Nekesa Mary Jashinta, and I teach in the School of Psychology, Department of Mental Health and Community Psychology. By way of introduction, I don't want to say that I have always been a teacher in the School of Psychology. My first degree in Makerere was a bachelor's in education with literature and English. And, okay, so many of my students are here today. So after my bachelor's degree, I went to teach at Green Hill Academy, the secondary section. But I had a dream to come back and do a master's. I had thought I would do a master's in education management so that I would progress as a teacher, maybe become a headmistress or something like that. But while I was at Green Hill Academy, I became a class teacher. And those who know Green Hill Academy, when you become a class teacher, you move with your students from senior 1 to senior 4, and then you go back and pick a class. But through that experience, I realized students had struggles, a lot of them. I was always having issues, students to punish, students to talk to other teachers, even the headmistress herself referring students to me as a class teacher. And I was overwhelmed. And the things that I saw that the students were struggling with, I felt I did not have the skills to actually handle those issues. So, I was there for 3 years. And then I just decided I have to come back to campus. But this time, I was coming back to do a master's in counseling because I felt the need. Now, I just want to clarify that many people usually experience mental health issues around them, but if they do not have a call to help, they may not notice. But for me, because of my call to help such people, I noticed and I was concerned about the issues that students were bringing up. They bring black shoes for school, and a child leaves the shoes at home and comes with brown ones, and the school pulls them out of class because they have the wrong shoes. And the parent is like, but I bought shoes. And the child is like, I don't like the shoes. I mean, those were, and it is a big thing at home and other issues similar to that. So that is what drove me to come back to Makerere University to do a master's in counseling. However, along my way of doing a master's in counseling, I actually was requested by the staff who were teaching me, and they were interesting me. Why don't you come and teach with us? One thing, I had a good degree as my first degree. All people who teach in Makerere, when you have a lower second or something of that kind, you won't get onto the teaching job in Makerere. So they really appreciated my skill and my heart for counseling. And of course, while coming to Makerere, I had thought I would train as a counselor and go back to schools and teach and continue with my work. But that didn't happen. I can testify that the last 2 years, I taught at Green Hill while I was doing the counseling program were the best years of my teaching in secondary school, because I felt empowered to help the students and the parents. Why then did I remain at Makerere? My teacher, some of you who are old enough know Vicky Owens. Vicky Owens told me and helped me to see that actually being at Makerere and inspiring counselors and training them was going to help me to place counselors in schools. And actually the counseling program usually has either 60% or 70% intake is usually teachers. And most of them go back to their jobs. It has been unfortunate that they cannot just practice as counselors because there was no designation for a counselor in secondary schools or even primary ones. But now that the Ministry of Education is making it a mandate that there should be a counselor in the schools, that means it's going to be followed by a policy, a position, and a salary. so we can place counselors there. And I'm so grateful about that development because it makes our training of counselors to be meaningful, especially for the schools. So my dream then became for me to inspire students who come to the counseling program and who do undergraduate programs to take up counseling and to help people out there. And I can say that the School of Psychology, and especially the Department of Mental Health and Community Psychology, has done a very good job of populating this country with counselors. The Henrys, Henry Subuga is our student, and so many others. All Healing Talk, Uganda Counseling Association is full of counselors from Makerere University School of Psychology. And then we also have a program in clinical psychology, Masters of Science in Clinical Psychology. I cannot exhaust how many clinical psychologists we have put out there to work in different situations in this country. So I just want to thank God for Tukule today, because this is even an opportunity for us to say what we are doing in Makerere. We actually put counselors into halls of residence every semester. Every semester, there are some counselors into halls of residence as student interns. So sometimes we have a low intake and we cannot cover all the halls, but they are there and they do the work under our supervision. So School of Psychology is doing a lot of work in this university, and we thank the wardens in the halls. They have been so good, and they work with us. Nowadays, we no longer have to go to explain ourselves and what our students are going to do in the halls. Once we send a student, we send a letter, they will always respond and give our students room to do their practicum, but also help the communities. So that has been my journey. Having done my master's and completed, and still dreaming of training counselors, I went ahead to do a doctorate in counselor education and supervision. So I'm a specialist in training counselors and supervising them, because that is what I did for my PhD in the US. So I take myself as privileged in a way to have had the opportunities that God opened for me to be in a school like Green Hill, see what I saw, and get motivated to come back and study, and also get motivated by those staff. I have mentors in Makerere. Professor Baguma were the people who were looking at my application when I applied to do my course in Makerere. Professor Monene, Dr. Owens, and so on. And they mentored me. I left Dr. Baguma as dean when I was going out to study. They have supported me. So I believe that it is very important for us to promote mental health. And each person has a story and why they got into the field of counseling. But each of us, working together, we can make this country, our schools, our health centers, our prisons, places where there is correction, adjustment, and rehabilitation. So that we are not just imprisoning, locking away someone, they come back as they went inside. There needs to be a person there to do the work of counseling and rehabilitating before someone comes out. So I'm so grateful sitting here and listening to the story of Daniel, the director, I know those stories. My students bring them back. We send students to schools for their external practicum. They don't do it in Makerere, they do 2 practicums. So after they have done one within the campus, they also find an organization or a school outside of Makerere and they do another practicum. It is so amazing. What Daniel told you is what we find in schools. You go to a school and you don't even want to pull back your student, but the semester is over and they are going to be there illegally if you continue. But otherwise, the needs are really overwhelming. And I just want to thank again Tukule for this, this opportunity for us to focus on mental health here in Makerere. So many things begin with Makerere. Makerere was the first one to start a course in counseling. And all the teachers who are in the other universities right now running programs in counseling are mostly from Makerere University. So when things start from Makerere, they spread very quickly all over the country. So welcome to Kule. I just wish you to spread your wings and move all over. Thank you very much.
A very good afternoon. My name is Douglas Ranga. You may be wondering, what is he doing here? Okay, I'm a media personality like most of us may know. I'm an event organizer, but also most importantly, I'm the founder and director of a brand new organization called the Purposeful Clinic Foundation. Now, where does this begin? It's going to be very short. Skills Clinic, over the 10 years I've been in the media working with young people, I've been majorly into entertainment, and that is presenting as a TV host on NTV, on NBS, and record television. But all the times I've interacted with young people, when young people see you as a public figure, as a popular figure, they oftentimes may not run to mama, they may run to me. And they would share, stories of pain or challenges they are going through. And I realized that the power that we have as public figures, it could be an artist, it could be me as a show host, is so much power to impact people positively or even negatively. And so throughout my journey, lots of young people have been coming to me very frustrated. And in one of the earlier presentations, we did actually reveal, I think one of the lecturers was speaking, and he did say the challenge of youth unemployment is one of our biggest problem and a big cause of poor mental health. Young people are going through campuses, universities, studying, and then they reach out there on the streets and they can't get the jobs. And those are the people you'd find the politicians using, and taking advantage of, that the government has actually failed to help you in this way and that way. And they'll hit the streets, they'll revolt, they'll do all these things, they'll burn tires, and all that stuff. So many people have been coming to me asking for jobs, asking for opportunities, and I'm also employed. But I just have influence in terms of presence on TV. And I was like, how do I change what I have to help so many young people out there that are challenged? And that's why we started the Purposeful Clinic Foundation. The problem that we discovered is most of the young people that have gone through institutions like Makerere, I'm also a product of Makerere University. I did my bachelor's in mass communication right here. So what we lack is young people are studying 3-4 years, they get their academic qualification, beautiful, they hit the streets, but the challenge on the streets is way different. The jobs that are out there, people are no longer interested in our academic qualifications. Matter of fact, I have never presented my transcript anywhere in the jobs that I've gotten. And so where are these people going to work? Because when you go for a job, they do not ask you, give me your transcript and all that stuff. They're asking you, what are you able to do? So if you do not have any skill on you, anything practical that you can sell to an organization or a company, you will lose out on the jobs. So our worker skills clinic is trying to just bridge that gap. That fine, you've gotten the qualification, the academic qualification, but let's give you the skill, the practical skill, so that you can either create a job for yourself or it can help you get a job. And again, I want to appreciate the Ministry of Education and Sports, because I think they realized that there's actually this gap right here, and they've modified the school curriculum in secondary schools to kind of include practical skills as children or students are studying. So if we keep doing like this and try and reduce youth unemployment, it will automatically also solve the mental health challenge in Uganda. So that's the most important reason why I'm here, and I am on this panel this afternoon to kind of share, what I've experienced out there. Thank you.
Good afternoon, ladies and gentlemen. My name is Evelyn Koniharono. I'm one of the counselors here at the university. I also serve on the current board of Uganda Counseling Association as the General Secretary. My passion for counseling started way back as a teacher like her. I was a secondary school teacher, and my last school was Tiber College. So I worked entirely with young people. I enjoy working with young people because I understand some of the things that they go through. And so my day-to-day work, generally speaking, at Makerere is talking to students, giving individual counseling and group counseling at the same time. This is it for now. I think we'll keep discussing more as the panelists ask us questions. Thank you.
Good afternoon, ladies and gentlemen. I'm Dr. Sharon Kezabu. I'm a psychiatrist. I recently finished my master's in mental health from Makerere. Today, yes, we'll be talking mental health, and I'm glad to be here.
Thank you very much, everybody, for sharing. I feel like we already have half the answers we're actually here for. Thank you, Dr. Nekesa, Douglas, Evelyn, and Dr. Sharon. It's really a pleasure having each one of you here. I'm going to start with you, Dr. Sharon. We've been here most of the morning talking about mental health, this mental health, that how it affects us, etc. But what is mental health? And what is the difference between mental illness and a mental disorder?
Okay, thank you. So when we talk about mental health is a state of well-being where one is able to realize their potential. So they're able to cope with the normal stresses of life, and they're able to be fruitful and be productive, and then they're able to contribute to their community. So when we talk of contributing to their community, it is, right from the start. Before even you get to the community, are you able to function? Are you able to, have those very good relationships, maintain stable relationships? Are you able to do those small little things that then, we are going to see a contribution to the community? And when we talk of mental health, we don't necessarily mean absence of disease. When we use the word mental health, it is more of well-being, the psychological well-being, the emotional well-being, that is what we mean by mental health. And then about mental health, am I able to even sustain my job? Am I able to wake up and do those small little things? That is really mental health. And when we talk about our next, yes, so our next question was mental illness and mental disorders, the difference between the two. What we need to understand is that actually currently these two words, mental illness and mental disorders, these words are used interchangeably lately. But to say is that initially we used to use the word mental disorders, but then later on, currently it is more of the mental illnesses. So mental illnesses, it it is broad. It refers to all those diagnosable mental disorders. And for us to diagnose the mental disorders, there's a whole criteria. So once we say mental illnesses, it is rather broad, and it refers to all those neurodevelopmental substances, those mood disorders, all those refer to mental illnesses. And when we talk about mental illnesses, it is just the disease of, yes, the body, the mind, that will affect your thinking, that is the cognition, the behavior, and the emotions. I hope that's answers.
Thank you. I would kindly request us to try and observe time. We have Madam Irene who needs to rush somewhere, so I'm sorry, but we might have to rush through the questions. Thank you.
Thank you so much, our panelists. My question goes to Evelyn Connie. Of course, you've talked a lot, most especially in the area of counseling and guidance, and we do trust your expertise. But now here in Makerere University, I think Makerere University is one of the leading university, and currently it has a guidance and counseling center, but also we can reflect back that Makerere University faced off some courses, and among the 18 courses faced by Makerere University was a bachelor in community psychology. What could really be the reason, and maybe what are the alternatives that Makerere has done to make sure they bridge that gap? Thank you.
Thank you so much. It's kind of an academic question, really. It's supposed to go to the academic registrar. But then I know that Makerere, by the time they phase out such a course, they have sat and realized that they do it according to what is trending in the market, but also other universities have come up, and Makerere wants to become more of a research university and doing more of graduate studies. So they do that not because the course is useless, but maybe as a way of distribution to others. So because this is not really a direct psychological question, but I know it's more or less academic, they do that after very good scrutiny and realizing that either this on the market, we may have to merge it with another course, or another university is doing it, so there's no need of doing this, because much as community psychology is not there, but doctors just said Makerere itself is training counselors under the masters. It's also training clinical psychologists. So it's not because community is not useful, but as academicians sit, they decide and say, do we still need to run this? Or maybe Mukono University will run it, or maybe Bugema University, such things. So because it's quite academic, I'll just end it at there.
Let me just clarify on that, because I have the information. The alternative that the university has come up with, organizational psychology and the Bachelor of Community Psychology, are being merged into one degree with 2 tracks. You can go community psychology, or you can go organizational.
Thank you very much, Evelyn and Dr. Nekesa. My next question is going to go to Mr. Douglas. First of all, I like the fact that you've already highlighted the fact that as the students get out of the university, they have a certain expectation, and most of the time they do find a different thing altogether out there. So my question is, again, like you already said, we're already traumatized about what's next. What advice can you give the young people that are here today listening to you as a successful media person? You've been out there, you now have Purpose Skills Clinic. What advice would you give the students who are here, and what can they actually expect once they're out there? And what is Skills Clinic doing to make sure that they reduce on the trauma that they already have about what's next? Thank you.
So to answer the question of what next, they need to answer the question of what can I do? That should ring at the back of your mind, yeah? Whether you have a degree, diploma, certificate, ask yourself, I have studied this, but what am I able to do? If you can answer that, then I think you have the answer. But like for my story, when I did my 4 years at Makerere for mass communication, I was so lucky that I allowed myself to start at the bottom. Oftentimes, young people want to study and get out of Makerere and straight up earn with a job of 2 million Uganda shillings. If you tell them, let's start from down, you would not look pleasant in their eyes, yeah? But you can still have a qualification and start from the bottom. And then you grow through the ladders until you reach up there. So allow yourself to start from the bottom, and then you can go through the processes. What is Skills Clinic doing? We are mainly in the field of skills training. We are giving practical skills that are able so that I know there are not jobs out there. That's a fact. And there's no place you're going to go to, even if it's the US, where everyone is employed. What do we have to do? You have to find a way of creating a job for your own self. Look at your talents, look at your interests. I was in one of the, I think it was a conference like this, still here at Makerere University, and I asked a girl who was doing a bachelor's in statistics, and I asked her, why are you doing statistics? Do you know what she told me? She told me, my mom told me to do this course. And clearly she did not have interest in this course, so I asked her, what do you want to do? And she told me, I love decoration. I love to decorate. And so parents, students, we need to kind of like harmonize certain things. Do not force a child to study something because in your family you need a doctor, you need a lawyer, you need whatsoever person. Allow the young students or the young children to kind of make choices a little bit and then give them guidance. I think that's the most important thing that we need to do. If that girl who wants to be a decorator starts a decoration company, there may not be many, but some of you who have done weddings, you go and look on a wedding budget and see what amount of money decoration takes. Isn't it the most expensive? 70 million, 80 million, even 100 million. One. Which corporate company would pay you that amount of money? Do we have any? Even the president gave us his salary the other day. Thank you so much.
Thank you. My first question goes to Dr. Nekesa. Of course, me being a mentee within the services in Makerere University, and also you being a mother, a counselor, a teacher, and a self-dedicated person, I must say that currently in Uganda, we have a vice where we have lost students to suicide. It has really happened in a number of universities, and the question is really alarming that what could be really the possible trigger to this. And as a member of the Counseling and Guidance Center, Makerere University, how can this vice be mitigated at university level? Thank you.
So, working in halls here, sometimes a suicide happens in another hall, and you're not even there. Maybe even your counselor is not on ground. And so the questions come, why are some halls having counselors while others are not? But we can't put their counselors unless we have enough number. So the counseling course, because of the intense practical work that is involved, takes in a small number each year so that we can manage them. And so we cannot cover every hall with a counselor, and even the hostels. So what triggers suicide? Suicide is an issue of either hopelessness, no light at the end of the tunnel. The person doesn't see any other way of escape. And as Daniel said here, you see this person is seeing death as the way to rest, as the easiest escape from what is happening around them. Sometimes suicide is also a result of anger, extreme anger, and wanting to punish the people who have, who have caused the pain. So the person, maybe especially when the person who has caused the anger is more strong, is a parental figure or an adult whom this young person or this victim cannot revenge, or avenge. The anger, instead of being turned outward, is turned inside, and therefore they end up dying by suicide. They see that as the only alternative. Then also mental health, illness, depression, or anxiety, everything that we can talk about, stress, bad relationships, all those that affect our mental health can also lead to suicide. So those are basically 3 of the 4 factors. Then physical illness. Someone is diagnosed HIV positive and they don't see any hope, no intervention, especially this self-kit, go and test yourself. Once they have tested themselves, there's nobody to talk to, they are frustrated. It can be, well, let me end this. Or cancer, some terminal illness. So those 4 factors are very instrumental in people dying by suicide. We don't say in the mental health profession, we don't say committing suicide. We say dying by suicide. I just want you to know that, because committing means I'm doing a crime. But when it is mental health and we talk about committing, then it means the person will hide it, okay? But when we want to remove the stigma and be able to relate to people who are struggling with that kind of ideation, then we need to say, to talk about it as dying by suicide, or seeing it as one of the options to solving their problem. So basically 4 things: hopelessness, anger, mental illness, or physical illness.
Thank you very much, Dr. Nekesa. My question is going to be directed to Sharon, again, Dr. Sharon. I remember Mr. Nsubuga earlier stated that a friend of his had to take a child for counseling, and they literally wanted an arm and a leg for payment. As a psychiatrist who's working with safe places, and you also work with Rocket Health, how best can we devise a way to make sure that some of these costs can be reduced, at least for other people, normal people who are here and need help and need counseling, can also be able to access these services? Thank you.
Thank you for that wonderful question. Yeah, so I would think that even before we actually go to, see the therapist, what are those that we can prevent? What are those that we can control, even before we rush to the therapist? So I would think rather, let's look at those small things that we can do and change right at the start. Then it is now later on now that we can't do that, then we can go there. So then that means that if we are able to prevent them at an early stage, then the cost is actually low. Then we don't need the money to go. So what do we do then? For me, I think actually what we are doing now is already a thing. Like we're already scoring an A because mental health awareness. We're already creating awareness, we're already doing the campaigns, and that's in a way putting us on a safe side. Then the other thing is be your brother's keeper, if I may put it that way. I mean, watch out for your brother. Look through, is she okay? What's wrong? So someone tells you, oh, I'm not sleeping. Don't just take it light. Ask what's wrong, what's happening? Have you eaten? Those small little things could, decrease on the costs. And then let's say that has failed, be supportive. Even to those that have the illnesses, you can support them in a way so that they can go for their reviews, so that even the illness won't worsen to, need further attention. So support them, be there for them. And then now, to those that are to seek out, help, yes, I think we have to support them. If it is your partner, then be there. If it is a son, a daughter, please save the little that you can and then be there for them.
Thank you so much. I think I still have one question to Evelyn, Connie. From the definition of mental health defined, we look at mental illness as a psychological disease, and it does not clinically manifest as other disease conditions. So as a counselor and as also a mental health activist, how can we really diagnose mental health at an individual and community level without maybe basically seeking for the medical attention? Because I'm sure we can solve this at community level as individuals. Thank you.
Yes, thank you so much. And I think in line with what Dr. Kezaba said, by the time someone is taken to an institution, to a hospital, that means things are out of hand. Even someone can either see that this person is not with themselves, they're out of reality. So before we wait to reach there, the first-hand support is usually the people we live with. If we see our person changing the way they behave, the way they speak, they are not eating, they tend to be lonely, those are the first things that we can know, because mental illness, those ones who are mentally ill and are lucky to be in an institution, they are even lesser than the more people who are suffering with mental health issues in the community. Because in the community, people suffer from the usual mental health issues, such as people go through moderate depression, mild depression. This can be managed from home and in the community. However, by seeking help from we call that, the doctors say primary, before you go to an institution, there's the beginning, okay? So when the person is identified and comes to me as a counselor, I'll do my assessment. And some of the issues arising from relationships, from the social, bit of it, or from the job, or from different other things. When things are handled easy, sometimes people just want to know that, oh, I'm not alone. People want to know that this will not kill me. We handle cases. I was handling a girl who had TB. She got TB as a student. But because she knows that everyone who gets TB dies, she did not have HIV, but because she was not eating as a child, she thought she wanted to make a good figure. And so she stopped eating food. Her immunity went low, and she, of course, attracted diseases such as TB. So this child was also suicidal because she thought she's already going to die. But she needed psychoeducation on her disease, to know that she's not alone, to know that someone cares about me. So those are some of the beginning things. Not that everyone who comes to a counselor has mentally broken down. It starts with, I don't feel well, I don't feel myself, I feel very low, I feel I don't want to come out and work. There are people who say, I don't feel like going to work. When you start feeling like that, speak to someone. If that someone is not able to help, let that someone send you to a therapist. Yeah, because I know sometimes there's a cost implication, but as government is now rolling out mental health, we are sure that even at the lowest health centers, we might now be having counselors. So people can now walk and just speak to someone. Not everything needs medication. That's why the doctor is maintaining that. Let us first do the first things, the community awareness that we are doing. If you're feeling like this, go and speak to such a person. So not everyone, not all mental illnesses. Mental illness means someone has broken down and they are now into an institution. But we all suffer mental health issues. I'm sure every one of us here, throughout the 6 days, you have one stressor But you might be stressed, but be able to work on it, and it goes. But if it's staying in day 1, day 2, day 3, 1 week, 2 weeks, you're still having heightened anxiety, fears, it's time to seek help so that it can be handled before you're institutionalized. Thank you.
Thank you, Evelyn. My next question is going to go to Douglas. We have had a number of people recently, mostly for you guys, the creatives and social media personalities. A lot of you, mostly because during the COVID pandemic, people were closed up, you weren't working. So a lot of people in the media industry got mental health issues. We also have an issue of, for instance, what's his name? Weasel, who recently had a challenge, and he was assisted in several other ways, but it was only recently that he was actually directed to a counselor who he only started counseling recently. So what advice would you give the young people, mostly in the creatives, to actually actively and intentionally take care of their mental health? And for people like us, like Tukule Foundation, who are dealing with mental health awareness, what do you think we can do to devise means to assist people in the creative industry?
Thank you so much. That's a very important question. And just as of yesterday, Skills Clinic and the Uganda Musicians Associations entered into a partnership to kind of help the creatives, with some of these problems. Now, these people that we see as public figures, the artists, go through a lot of challenges. You see Weasel beating up a wife, dropping the kids, very young babies, early morning at the gate of a nightclub. You see Winnie Nwaji being chased from Ministry of Internal Affairs because of indecent dressing. You see the Ministry of Education and Sports saying, okay, we are tired of you artists going to schools because you're negatively impacting on our children. And we actually all seeing the problem. And I don't think we've tried hard enough to find the solution or solve the problem or even meet the artists and find out what the actual problem is. So that's why Skills Clinic entered a partnership with the Ghana Musicians Association, so that we kind of go through some level of training. But even if we do this, me personally, I have friends that have gone through drug problems. And there is a particular place around Bakuli where the traffic lights are, where these drugs are sold. And the police is even aware of the spots where these drugs are sold. That drug is very expensive. You need about 50,000 to 100,000 every day to service yourself. How much of that money would you have saved? And if you don't take that drug, by the way, if you haven't taken it the whole day, late evening you start shivering. I think it's called relapse?
It's withdrawal syndrome.
Withdrawal, yes. Case in study, Weasel. Weasel is very willing to get off the drugs, very willing. But when you sit with him, a friend of mine decided to be with him like the whole day so that nothing happens during the day. And it reached evening because he hadn't taken the drug. And you would feel like he's running mad or he's getting crazy. You would get so scared. And when you sit with him and you ask him, okay, who supplies these drugs? This is a very deep problem that these drugs have even entered the schools. All these people that we used to have, the senior women, all those people that used to, help keep the children in order, I think it's way out of hand, like they do not know the new forms, like how do kids hide these drugs and all that stuff. So as we blame the artists, let's realize that it's actually a very big problem that each one of us needs to solve. But me personally, I think the law enforcers have a big, big deal to play in this. Because if we restrict the entry of these drugs, there are so many drug lords in this city. Some are in these nightclubs. And the communities know these people. So why haven't they been taken to Luzira or wherever? Something is amiss. So until we find a solution to that, we are going to blame Weasel, we're going to blame Winnie Nwaji, we're going to blame everybody else. So let's go to the root cause where this problem is coming from, and let's try as much as possible to solve it. These people are very well known, the people that trade these drugs. But somebody is deliberately ignoring them. So, Tukule, I don't know if you have power to force the police to do its work, or the law enforcers, but if you can do that in advocacy, I think it will go a great, great deal. In fact, by the way, we even tried to do a campaign against the drugs. These people are so highly connected that they will threaten you. That's how bad it is. But the places where these drugs are sold are known. My friend MC Katz, the girlfriend Fie, was going through that same problem for a very long time. And she used to escape and create excuses. I need money, I have a headache, I have a fever. And so we started to follow her, see where she was going. And it was the same place, Bakuri. So we got guys there, took them to police. 3 days, they were released. And the business is still booming. So we have a big problem, and if we don't address it, you're going to find everyone, and these things are... Let's end there. It's so annoying, very annoying.
So I guess we'll have to take it upon ourselves to create the awareness and also ensure that Madame Irene and the rest of her team from the First Lady's office also get involved, hopefully.
Let me interject, since we have... You remember how President Museveni wanted to fight corruption? And he got Afande Edith Nakalema, like operation that, yeah? If we could do an operation in that line, and we have somebody with so much authority to kind of just like round up people, I think we can start from there. And we have the power. Just suggesting.
Well, this is really a fruitful discussion. I think I'm really most interested in right now, I think basing on the definition of mental illness by Dr. Sharon, I really feel like you have a lot of experience because you have worked with the many mental health institutions. Now, I think to the community observation, it is noted that about 80% of the mental health patients seek traditional healers before they seek the medical care. So we really think that could this practice have an effect to the administration of the mental health care? Or maybe if this has happened that this community visit the traditional healers before the medical care, how can this practice be mitigated? Thank you.
Thank you so much. An interesting question. Yeah, so when you ask of does it actually affect, the care, the administration of the care, of course, in one way or the other it does, because it delays the process. So in a way it means by the time someone now comes to us, something that could have been managed way earlier, it has, now worsened. Or in some instances, maybe they will stay there and will never come. And if they are to come, then it is at that worst point, yes. So in a way, it does affect administration of care.
I think still on the same note. Actually, we have even, I think, because we come from communities, we realize, I think the community still has a belief that some of the mentally disturbed patients who have been, who are dismissed from the hospital to go home still don't recover, and then it has necessitated them to go to these traditional healers. Now, maybe what we are worried is, are there some mental health disorders or cases that are incurable at the medical care? Thank you.
So our goal in treatment is to improve the quality of life. Quality of life means that, someone who was initially not able to work well, maybe they are now able to do that in a better way. So our goal is, what can I improve now? How can I improve their life? Someone who was no longer working, they are now able to do that. So, mental illness, they are curable. People get better. What is disturbing us is the stigma out there. What we still hold on to and think that, this person was once mad. They were once in a mental hospital. They can never be fine. But as long as we change that and support them, we hope that things get better with time.
Thank you very much, Dr. Sharon. My next question is going to go to Dr. Nekesa. We've been talking a lot about mental health, and like the question my colleague has just posed for Dr. Sharon is the issue of myths. Like people always believing maybe this is witchcraft. It's like, it's hard for a person to believe they're actually genuinely having a mental health condition, and mostly due to the fact that some of us still do not believe that mental health is actually a medical condition. What do you think we can do as, first of all, as the university, and secondly, as organizations that are coming up to create mental health awareness, to ensure and sensitize people that this is actually a condition that has to be looked out for?
Thank you, Rona. When I answered the question about suicide, I think there was something about how we can manage it, and it all ties together with what she's saying. My whole idea is around intentionality, being intentional from the very beginning. All these problems about going to witch doctors, about people believing that certain illnesses cannot be cured, looking at suicide as the only option, they all come around with the issue of no education from the very beginning. To me, I believe that if each school has a counselor, just as we know there are things we learn in school, basic writing and reading. We learn it in school, and so many people, when you look at the percentage of people who do not know how to read and write, it is narrowing down over the years. That means that the issue of mental health and how to handle it, the gap between those who know and who do not know will narrow down when issues start from school. Most countries which have counselors within the school, their programs are integrated. Counseling takes a docket just like math or English. There can be a class at least once a week, to talk about issues to do with mental health. Children need to know about who they are. Children need to know about how to develop their social skills. Children need to know about career choice. Children need to know about how to handle stress, maybe at home, or parents whom they feel are stressful, how to be assertive. All those things are taught by counselors. Simple lessons, even from as early as primary 1, primary 2, into the curriculum. There is something about, because life is not about math and English and biology. That is not where life ends. We must first learn how to live life before we can use the skills that come from these subjects. So that is my cry, and that is what I saw at school that motivated me to come back to campus, not to do a course that would lead me into an administrative post, but rather to do a course that would help my students who were struggling with various issues. So for me, I believe that basic health care education from the very beginning of school. By the time a person is in primary 7 going to secondary, the mysteries about depression, about stress have been removed. Now they know that, oh, I am failing to sleep. I'm failing to sleep. I feel like being alone. This could be depression. But if they don't know, why would they not go to a witch doctor?
Thank you very much, Dr. Nekisa. I would like for you to kindly add on, like, first, you just stated, like, some of us still do not actually know, am I depressed or this? So how can I, if I'm feeling depressed or anxious or stressed, how can I differ those 3 different things to know that maybe right now I'm depressed or now I'm anxious or stressed? How do we differ as individuals?
Okay, so anxiety, depression, and stress. Okay, the difference, actually, anxiety and continued stress could lead to depression. So we first begin with anxiety, panic kind of, I am late. But if you're always late, for certain reasons, you could end up in depression as you're losing either your job or you're failing to manage what you're supposed to manage in time. And it is a symptom, a pointer that something is wrong. All of us know that if you're not feeling well, you're unhappy. Maybe your friend made you sad. Let me say it that way. You might drag your feet in the morning. You wake up in bed, you're not as quick to go to the bathroom and finish off and dress up quickly. You might not even dress up brightly. You might put on anything that you come across because your emotions are going to be reflected in how you dress. You're feeling low, you want something, you are not feeling like being bright and, So all those things are pointers that something is happening. And I think, as I've already said, when we sensitize children from a young age to start self-reflecting, what is happening to me? I would take myself as an example. When I'm feeling low, I start asking myself questions. Why am I feeling like this today? Okay? And when I see nothing has really happened that has upset me, then I start asking myself, have I taken enough water? Have I eaten a meal today? So that I evaluate where that problem might be coming from for me to feel low, downcast, or something like that. But unless our children, or as we grow into adulthood, we are in the habit of reflecting on what is happening with us, we can never identify what is making us anxious before we identify, okay, I'm in a stressful environment. This job is really stressful. Every day, I no longer want to wake up to go, I'm no longer excited to go to work, and so on and so on. Now you're realizing there are stressors in your environment. Oh, this person, whenever I relate to them, I feel worse about myself. What is it about our relationship? Is it the way they talk to me? Is it the way they put me down? And so on. You're starting to realize that there is a stressor in your environment. And then that is the way you block yourself from running into depression. But when those first small things go unnoticed and they are not even considered, then you will stay in that stressful situation, and at the end of the day, you end up depressed. So these are degrees of moods. Anxiety is just the panic, fear, the apprehension that something bad is about to happen or will happen or has happened. And then stress is more of there are too many things for me to do, or there is a lot going on, I'm out of control, you know, as far as the daily things I'm supposed to do. That is already stress. Then depression, you find that depression, now you're feeling despondent. You're feeling like you have no control, most likely at all. You're feeling as if there is nothing you can do about the situation. And you are sad all the time. You want to be, you're feeling hopeless. So these are degrees of sad moods. And we depend on the length, how long has it been happening? If someone is just saying today, then I'm most likely going to talk about anxiety. If it is more than 2 weeks, I'm most likely going to say this could be stress in the environment. But if it is more than, beyond 2 weeks and ongoing, and there are those symptoms of I am losing interest in the things that I used to enjoy to do, then we say that is depression. But having said that, that is the layman's way of doing things. We have skills as counselors, professional counselors, which we use to quickly, within 3 minutes, someone answering a few questions, we already know whether they are clinically depressed, anxious, or stressed. So there are things that we, skills that we use, instruments that we use to diagnose stress, to diagnose anxiety, and to diagnose depression.
Thank you very much, Dr. Nekesa. I think due to the interest of time, my colleague is going to ask one last question, and then we'll receive questions from the audience. So prepare, if you have any questions, please direct it shortly. Thank you very much.
All right, thank you so much. Thank you, our dear panelists. This is an all-round question that goes to everyone. I think by the time you answer that question, we are done with the moderators, and then we take questions from the audience. Uganda currently has one mental health hospital, that is the Butabika, and then also there are few psychiatric units across the country. And of course, looking at the demographics, 80% of the population of Uganda lives in rural communities. This really shows that majority of the population has limited or no access to the mental health care. So as an advocate for mental health, how can this service how can this service be taken back to the community? And then also possibly, which advice can you give the current mental health institutions in this summit to implement their activities while addressing the issue of the inadequate mental health services at the rural areas? Thank you.
Is it me or he was looking at me and so on. Anyway, for me, I believe that the issue of mental health is more of this. I'm going to make this for you because I have nothing here to. The major entry, the entry into mental health problems starts from this end. Many people coming. Here, there are few people who end up here, okay? And that is what the hospital deals with. So, if we are to do our work the way we have been describing here, and make sure we catch people before they come this end, the hospitals will have fewer work. That doesn't mean that the institutions should not grade up and do their work. I want to appreciate Uganda. There is something that has been done. When you're not in the circles of mental health, you might think there is nothing being done. But there were times when at grade 3, grade 4 hospitals, there was no mental health unit. Right now, they are there. So we need to really appreciate what has already been done before we talk about what might be lacking. It has been a long journey, and I think they are doing well. If we keep up with what is happening, we are going to do better. But my emphasis, prevention is better than cure. Let us start by catching all the people who might enter into this channel before they reach this end. Okay? Because actually, counselors, social workers, employees, employers, all these kind of people who daily families, parents, we are all stakeholders in this. It is not an issue of a counselor or a psychiatrist. It is us who are stakeholders. Once we catch people before they fall down the tunnel, we would have done great work. So for me, that's why I really believe in training counselors, giving simple psychosocial skills which can help us to be better friends and to be our brothers' keepers, so that we minimize how many people may need medical attention.
Thank you. Mine, I'll still echo what you have said. Prevention is better than cure. Oftentimes, people go through so many challenges, and they find it very difficult to approach somebody, probably a friend, relative, and share. Very few people are willing to go as far, look for a counselor, look for a hospital, look for safe places to be treated. But the immediate person is your friend, is your sister, is your parent, and all that stuff. And we are living in a world where everybody is busy for each other. So let's start from the very basic thing, yeah? In the morning, ask your friend, are you okay? And not just asking, are you okay? You know these things where you say good morning, and you say good morning. Are you okay? I am fine, but you're actually not fine. But ask, are you okay, for the benefit of wanting to know if they are really okay or not. And once in a day, give people time. When you meet somebody and they want to talk to you so badly, save 2-3 minutes. Because you never know. That could be a life-changing time for that person. People are suicidal, and they just need that one person to talk to them and tell them it's okay. So if somebody approaches you, create that time. Then we wouldn't be able to flood the hospitals. This is how we solved issues like COVID-19. Why wait to go to Mulago, yet you can actually just wash your hands? So reaching out to people, giving people time, and just conversations generally, I think, can change lives.
In the same line with the current speakers, I want to also echo that, yes, government has really done a lot, and we can do more by more sensitization. What we've done here, we are working with people who have already gone to school, elites who can even go to the internet and read something about mental health. But the other day we were at the counseling center, and we were supposed to go to the community, just Chikon here, and my director, Mr. Nsubuga, we were asking ourselves, okay, how do you say mental health in Luganda? And then we were saying, you know, struggling with a lot of words. So people in the community who have not gone to school do not even know the meaning of mental health. That's why they understand physical health, because when someone says nino omusuja, they have malaria, then they go to the hospital. So we are asking now that we are in an academic institution, that this mental health, we can have a translation in different languages. What does depression mean in Luganda, in Acholi, anxiety, so that down the grassroots, because we are having, and you know mental health, there's a relationship between mental health and poverty. So the lowest person, even the high person gets mental health, but everyone has a category. We have people committing suicide at the grassroots. When you talk about suicide at the grassroots, they will say, no, that one is witchcraft. So if you do not have a word to use for depression in a certain language, and I'm going to go to the community, then I say, Olina depression. Yeah. The person will not even understand. So since we are in an academic institution, let us now think about putting these things in different languages people may understand from their mother tongue that when I have a mental health issue, it does not mean that I'm, I don't like using the word mad. I am mentally ill or I have a disorder. I am having a normal mental health issue and I need to speak to someone so that I can get better. So we need interpretation in different languages to the lowest grassroots so that we can all now be at par when we speak of mental health. Yes, thank you.
Yeah, I think what we need to do is to make sure these words are all over, but they are already there. Okwenyamira, Okwenyika, and other languages also have the words are out there. We just need to, it is an issue of sensitization, but the words are already there.
Thank you. Mine to say is that let's end the stigma towards mental illnesses. Even if we build the hospitals here, another one there, as long as there's stigma, then the hospitals will be empty. So for me, it is let's end the stigma and then these people will come to these hospitals. Then another thing to say, we don't have to look at only Butabika. What we need to know is that all regional referrals have mental health services. And even beyond the regional referrals, health center force, they have someone you can go to for mental illnesses. So we don't have to just look at only Butabika. Even beyond that, private hospitals have mental health services. But above all, the goal is primary prevention. Let's learn to prevent all these. Let's end the stigma and look out for your brother, look out for your sister, then let's end the mental illness, let's end the stigma.
We shall be receiving questions and we shall start from here. Other people be writing them on paper, they're moving around to collect them.
Good afternoon to us all. My name is Bonnie Tumusime and I'm speaking from a point of someone that has been through a depression for 3 years, but I overcame it. It nearly ended in suicide. The worst part, I tried alcohol, but it failed. So when that failed, I tried masturbating. I really masturbated a lot, but I thank God I never lost my manpower. It's not really funny. So there are a few things, like mine is a question and also some kind of submission. There are small things that I tried out that helped me become a person and maybe also helped me to live right now, because maybe I would be dead. First of all, I started crying. But if a guy, I advise that you cry when you're hidden, because it's not good for a guy to cry in public. Then also, I opened up to my mom. First of all, after all these 3 years, she didn't know whatever I was going through. So I took that step to open up to my mom, and she was really helpful. She really helped me to recover. Then thirdly, I just realized that we young people are in chains, and of the society, our pastors, our social media, they all have these expectations of who they want us to be. So for me, what I did is I took this radical step of just realizing that, oh, my life is mine, and whatever I'm doing, I'm just putting me first. And then also, another thing I did is I started keeping some money on me. By the way, it's very hard to get depressed when you have some money. So I just, yeah, it's true, by the way, it's very true. It's very true. So lastly, I also started embracing the fact that technology and globalization is presenting us a lot of opportunities. For example, you can be whatever you earn, make some money still using just technology. So it also helps us to learn some skills. So my question to the panel is, I've also realized
Okay, my name is Tina, and my question is, what do I do if the support fails? I'm bringing that in a perspective of, personally, I also have a mental health program that I'm running, but sometimes, I can be seeking for help in mental health, and there is someone I'm supposed to help. Like, for example, I have a brother who is going through depression, but this boy cannot open up to me as the sister. And when you tell this boy to open up to maybe someone who is a counselor, there is a way he feels like, how do I open up this? And what if it doesn't help? So my question is, what if I that help, or for that what?
Thank you so much, the moderators. My name is David Kwagala, and I'm the team leader at Hope Awareness and Literacy Club. Thank you so much, the panelists. This is to the parents. Mine is a reaction to the parents. Parents, the 8 a.m. to 5 p.m. corporate world has taken away our responsibilities. We have dumped the responsibilities, and we have given up our children in the cave. So, Tukule Foundation, I think we need to conduct Moligo clinics, not only in schools, but also bring the parents together. Because parents have surrendered their children. 8 to 5 p.m. has taken our responsibilities as parents. The other thing is rejection. In my organization, last year, December, we lost a beneficiary. A gentleman, very young, vibrant man, died because he was rejected by a girlfriend. Girls that are here, please, please, I am appealing to you. There's a better way to say this person no than saying you don't have money, than dumping this person, saying all sorts of words. Kindly, you can at least brothers on this person. I'm telling you, than saying you don't have money. If you don't see future in this person, there's a better way to relate with this person. I am kindly appealing to you, girls that are here. Lastly, this is my last one, is especially now to the students that are here. We need to learn how to handle expectations. You're in school, you're done with school, you have your expectations, but then also society has their expectations about you. You're done with school, but they're like, yeah, but Flavia, by now you should be married, you should be driving, you should be at least helping your brothers or your siblings. I think we need to learn how to handle expectations. Failure to learn how to handle expectations has resulted into mental illness or mental disorder. So if we need to learn that this is your personal life. You went to school alone. Thank you so much. Thank you so much. This is such a very good platform. There's so much would have said, but because of time. Thank you.
Good afternoon, all of you. I first of all want to thank our panelists. I have two questions. One is going to Dr. Sharon. Dr. Sharon, I'm a peer educator, but as a peer educator, we are facing a problem. You've talked about stigma. How can we go about self-stigma? Because leave alone the stigma around people, but we also have self-stigma. Can you help me and understand how we can go about it? Another question is going to Mr. Douglas. Mr. Douglas, I was so happy when I found out that you had the purpose skills, but you've talked about something, us starting up our own businesses. I personally have done a lot of skills. In every vacation, I used to go for skills, but we don't have capital. We've been hearing this from meetings, from conferences. They're telling us, start up your own businesses, start up your own businesses, but we don't have capital. Where are we going to get the capital to start up the businesses? Thank you.
Thank you very much. My name is Christopher Abine. I'm a student of community psychology. Well, as students, we have a challenge, one that I've encountered while conversing with fellow students. The fact that we are here for success, for academic success excellence, we have a challenge with attention, concentration. You know, you get into a book, you're reading for an exam that's there tomorrow, but you are not taking anything in your mind. It's a really great problem, but it's a problem which people won't say out that much because people wagendo gamba mbumstido, they will say that the person is not, he or she is dense. So attention is a big problem. Then about Douglas's issue, I would like to hint on drugs and celebrities. I think the celebrity world needs to look out for a way of dissociating drugs from they themselves. The way sports personalities try to dissociate themselves from drugs and other misbehaviors. Thank you.
I think that's enough, unfortunately, because we really... Okay, one last person. We're really running out of time.
Yes, mine goes to doctor. Yes, doctor. All what we are discussing about is the challenges of mental health, the girlfriends, how to live life.
Excuse me, 1 second, please. Esther,
so,
can you please get a microphone to this gentleman here? Thank you.
So, doctor, let me finish mine. All this is all about mental health. Mine goes, how can I know that I'm ready to live life? Because you have talked of the issue of knowing how to live life. How can I know and how can I tell that I'm really fit to live life? Douglas, you talked of being popular in the public. When these people really land on you, how do you advise them to really live life? How do you go about that? When I come to you and tell you that, yes, Douglas, things are hard. How can I go about this? Some people tell us that you people, you voted bad, you voted no. So those stories, they can really make me feel as if I'm not. Thank you.
Okay, let's kindly have the last question and then allow the panelists to respond. Thank you.
Thank you so much. Twekambe Kawarul is my name. I'm a renowned blogger here, a content creator, marketer, and all that. Actually, I'm one of the top influencers in the institutions of higher learning.
Esther, where's the other microphone?
Yes. When Mr. Henry Subuga was starting this function, he said that it's true that we don't give attention to the psyche part of it. And that, you know, unless you have a bodily disease, that's when you will know that I am not fine. He also acknowledges that and is the director of guidance and counseling. But the problem is so much in the institutions of higher learning. Actually, it is everywhere. That's what I should say. One thing is that I would like to request all of us who are here. It's true that we all have mental health problems, including the people sitting on the panel. Yes, but my simple request is to the people who are in this room, can we sit down and devise ways, at least we should be the champions of saving this nation, because we are doing bad love. I do positive publicity. I do marketing. I concentrated on marketing Makerere and the Makerere community members. But from 2019, I've never received any funding. I believe I am one of the guys who actually has the brains of the first developed countries, but stuck in the third world country. Yes, just like the man says it. Yeah? So, like I said, I am in over 1,000 plus WhatsApp groups. We are on Twitter, Instagram, and all that.
Let's
I've
kindly
been
direct
attacked
a
by
question.
depression for 2 times.
Let's kindly direct
It's
a
good
question.
that
Thank you.
surely I've survived that. I do not know if the 3rd time I will survive. But one thing I want to request you is that let us devise ways, use platforms. You can't do it alone, but let us devise means more so in this digitalized era. Use us, we reach out the information. Thank you very much.
Can you kindly give that one, thank you. For the last question, him. Thank you very much.
I thank the panelists, Mbazira Antone, private sector, Mackay University. Mine goes to both doctors, and then Professor Baguma. I also saw a reverend here will help us. Contraceptives are done a wrong issue in Uganda, and even Africa, contraceptives. That's the key issue behind drugs, but contraceptives, because women swallow these contraceptives almost every day. And they started them at early age, 18 years. There is a paper here from a certain university in America. All these are motors women take at early age. So the kids are suffering because of this, and even the title is there, youth. They are the ones targeted now. So unless we tackle this issue of contraceptives, that's the answer only for all these issues. COVID-19, what? That's nothing. It's called contraceptives.
Okay, let's kindly allow the panelists to answer first the questions that have already been asked. Then we can see if we have more time. Thank you. Hold on, please. Thank you very much. We'll start with the first question of, I think there was a lady seated there who asked, what can she do if she feels like she can't help anymore? I think it was directed to you, Dr. Nekesa and Dr. Sharon.
I want to let you know, my dear lady, that there are also times when I cannot help. And I have devised a means of referring. Because when a person is too close to you, for example, it's my brother's daughter, I'm going to be biased. So, I have devised a means of referring. If your brother lands in the hands of a professional counselor, they will see a difference. The whole issue is that we talk about these things, but the person has never stepped into a professional counselor's office or hands. And so they have these myths about it will not help, they will, your work is to try and convince them to be there or to line up a professional counselor for that person.
Thank you very much, Dr. Nekesa. The next question is directed to Dr. Sharon. How can one overcome the stigma? She said she's herself a mental health peer and educator. So how can she overcome the stigma within the process itself?
Thank you so much for the question. Specifically, her question was about the self-stigma. And when we talk about self-stigma, it is that is caused by you. Those negative thoughts about everything about you, it is just from you. So I would say that for us to overcome that, slowly begin with that positive self-talk to begin with. It is you've woken up today and you're thanking God, I am glad I'm up. I know today I can sail through. I know I can do it. It is, you're moving out to do something which you actually feel like is a big thing you might not be able to do, but then you're saying, I know I can do it. There's power in what we think about, in what we believe in, and in a way, that can change. And also, I think sometimes this self-stigma comes in because of the competition around us. There's a lot of competition. And in this era of social media, of Instagram, of, everything happening, you're looking at this person and you're comparing yourself with them and you're thinking, oh my God, I am nowhere. So I think we need to know where to draw the line. We need to set the boundary with these things that are happening, and even in the way we compete also needs to, to change in a way. Then also self-care. It is those small little things. Let me take time off social media and relax and think and, meditate, those small little things. And also, yes, I talked about the competition, and then stop comparing yourself with others. We are all different. Take it slow on yourself. It is today this person is driving, but maybe it's not your time. Maybe you're meant to drive a year after, It is those little things. Be slow on yourself, be gentle on yourself, and I think with time it gets to be better.
And the other question, thank you, Dr. Sharon. The other question was to Douglas. They were inquiring what you keep telling them they should start their own businesses. What happens if they don't have capital? What should they do?
That question is interesting, and I think it goes way back from, I think, the way we've been raised, culture. We've been raised with a culture of being given. Everyone, and that's why you find young girls, when they grow up, they reach campus, they start looking for a rich man. Am I wrong? I'm wrong. So also looking for rich men becomes a career. Because they don't want to work, they want a rich man who is gonna provide. I'm not saying men shouldn't provide for the women, but women need to be independent. I have friends, because still I talk to a lot of young people, they date for that reason. For some time, this guy impregnates them, and then after he has gotten what he wants, he takes off. And that's why we have so many young single mothers. You're from campus, but you're already a single mother. The problem is being what? Given. Capital. The greatest wealth is not money. What is the greatest wealth? What? It's people. It's social capital. That's it. Every one of you has a mobile phone. You have 1,000 contacts. Try and get a problem. See how many of the 1,000 would come to your rescue. Then you'll weigh yourself if you're really rich or poor. Lastly, capital. For you to start a business, you don't need money. You need the idea. Do you think anyone gave me money to start Skills Clinic? Not even the government. I have money. So where did I get the money? Hi, I'm hearing all sorts of answers. I wish we could elongate this further, but what I want to tell you is that there is wealth in people. If you have a skill, the other girl that I told you who wants to do decoration, she shouldn't start that company of decorating herself. She can go look for a decorating company and say, I want to volunteer here. When I left campus, I went to a small video production company where I learned graphics, design, editing, and all those skills. Then I went to TV. You understand? So if you have these skills, go to a place that's already practicing these skills. Don't start by asking them for a lot of money. Start from just that opportunity to work under there. Perfect your skills, build this profile or portfolio, and then of course you'll go on and start your own business. But don't start from scratch and you want to start your business. That's wrong. Then lastly, to the government, don't give youth money. Let me end there. I'm going to create a lot of enemies. Thank you.
Thank you very much, Douglas. Unfortunately, we're really running out of time. However, the beauty is we still have all the panelists around, so you can take time during our lunch break, which is going to be after our keynote speaker. You can then come to them and share with them and, inquire whatever it is you want to inquire, questions, anything that you want to share with them. Thank you very much. Our panelists, you've been amazing. Thank you for your time. I'd like to also take this opportunity to appreciate Madam Irene for joining us today. Thank you very much. And we hope that you have an amazing communication from the First Lady's office. And once again, thank you very much for making this happen. It was not going to happen without your support, so thank you very much. Okay. Can they? Okay. Okay, so we're going to kindly give the keynote speaker a chance to speak, and then after her, we're going to have our lunch break, and then we'll proceed with the program after that. Thank you very much, everybody.
Right. Good afternoon, everybody. The Office of the First Lady, in particular, Irene Kauma, we're very, very privileged to have you. All members of government that are here, all protocol observed. Professor Baguma, from the Dean, representative of the Dean, I acknowledge you. To Kule Foundation, these young people that are revolutionizing mental health and equipping the youth, I acknowledge you. Students who are here, ladies and gentlemen. My name is Lindsay Chinkweire Nzeyi. I am a counseling psychologist by profession. I should also say I'm a mother and grandmother. I'm privileged. I'm enjoying those moments. First of all, I congratulate Makerere University for 100 years of existence. Isn't it wonderful? Yes. It's a momentous thing to be able to celebrate 100 years. I don't know anybody that's 100 years right now. I'm sure they're there. But it's quite interesting. Now, recently, because of this mental health celebrations and also because of this 100th anniversary, we've had a lot of prominent people talk about Makerere, their experiences, their first experiences here. And some of them were really beautiful moments and memories that they had here when they came. And I also am privileged to say, I want to put my voice to those and say, over 47 years ago, I was a first-year student here at Makerere University. And for the first time, I sat in the main hall. Thank you. In the main hall, you know, when I was coming here today, I realized there are many auditoriums. I didn't realize those days, there was just the main hall and a few other lecture rooms around the campus. But to see how this has grown to be a major institution, it's really wonderful. And me coming back here to talk about mental health, to talk about hope, the hope that we have in the youth, is a privilege. And I celebrate that, and I acknowledge Tukule, in particular, the young man Daniel, for inviting me. I'm a counseling psychologist. I did counseling psychology here and economics at that time. And then I went on to do a master's in counseling psychology. Right now, I am working in a rehabilitation center for drugs and alcohol. So that's what I do on a daily, and also counseling, you know, counseling as I'm a therapist, as you can imagine. So I won't talk too much about mental health. Professor and Henry and all the others have already spoken a lot about mental health. But I like to talk just to say the World Health Organization definition of mental health kind of brings it home, brings mental health home to us as people. It says that a state of well-being in which the individual realizes his or her own abilities, part of what has been discussed by the panel, can cope with the normal stresses of life, can get on with life despite the stresses, because the stresses are there, they're unavoidable. But if you are able to cope with life, you can work productively and fruitfully, and you are able to make contribution to yourself and your family and your community. Then you are in good health, in good mental health. I have had a lot of submissions from young people here who've gone through specific mental health challenges and who have overcome. Maybe some haven't overcome yet. But the fact that you are here, it shows that there's a degree of coping that you have. You are seeking help in a roundabout way, but you're seeking help. You are here, you are listening. Therefore, this is an opportunity to bring that mental health wellness home to ourselves as individuals. So this definition also implies that our mind drives our lifestyle. A healthy mind, positive thoughts, they contribute to a healthy living or to healthy living. But is it possible to maintain this state of nice, feeling good, being mentally well? Is it sustainable? From what have been submitted, obviously, the answer is not. So let's talk about where the mind is. The mind is housed in the brain. And we know that the brain records simply everything. The brain records what you smell, the brain records what you hear, what you see, what you feel. Everything is in your hard disk of your brain. And every once in a while, all this information is retrieved in order to be used currently. So if you've felt a hug from your mother when you were little, and then you have this child that is around you, and you feel like hugging them, you know, it is something that is reproduced from your experience, from your memory. So the brain records both good and bad things. It records everything. So every bad experience, every unfortunate experience is also recorded in the brain. And the brain sometimes replays the things that you have already experienced in the past. So let's consider these scenarios about our mental health being, where we are coming from. Are we mentally healthy or are we mentally unhealthy? And if so, how did we get to be where we are? And I'll just use a few examples from our communities just to kind of elaborate that. So let's look at a child, an individual, now grown up, who was abused as a child, who was neglected, who went through some kind of trauma as a child. So they have now become adults. How do you think they can avoid these terrible memories that lapse back, you know, into their present, into their current life? How do you think they deal with them? How do you think they picture themselves? Someone was talking about, you know, self-stigma. You know, how do you now look at yourself with that experience that you've had in the past? We hear about, or rather we see every day, the children in our family, in our streets. These young kids, they can barely walk. They are sitting on the side of the street. They have their little hands held up and they are begging. These kids cannot talk. They don't know how to talk yet. They're not 2 years old yet. And yet here they are being trained or habituated into this behavior, this terrible behavior. And then you expect these people to be mentally healthy human beings or adults. We hear about these children getting raped in these makeshift places where they stay, and they get pregnant at 12 years old before they've had even their cycles established. We know of people who are intensely lonely, even when they're in the middle of a crowd. They go to a party or they go to a social function and they are lonely. We know of people who are socially disadvantaged. They live in abject poverty. We have slums all around our city. There's no water, there's no proper shelter. They've hardly had enough to eat. We've heard of people who find themselves in insurmountable debt, like Daniel said earlier on, and they're constantly thinking about suicide as a solution. We've heard of people who have not been able to cope with the loss of a loved one. In fact, to the point that everything else around them loses meaning. So we also know of people who can't sleep more than an hour a night because the thoughts don't stop. They're constantly alive. And they spiral into a state of loss of control. So we also know of people who have resorted to drinking and using drugs, and we've had this young man's submission and testimony. By the way, can we clap for this young man? Yes, because they are desperate. They resort to engaging in all these behaviors that are out of control. We've heard of students being bullied to such an extent that they are forced into sex. They do their labor, even for teachers. Some of our ex-combat soldiers, they are battling with PTSD, post-traumatic stress disorder, and they are consequently endangering their own lives and endangering themselves and their families and communities. We've heard of when they've just gone around and random shooting around in the community. So we can really safely conclude that these people that I've described, or these scenarios that I've described, indicate that we are all subject to moments or periods or phases of mental unwellness because of our circumstances, because of our experiences, and because of what we go through. And because of that, these people are more than likely to develop these mental health conditions. I think Dr. Nekesa described of how a normal feeling of anxiety or a normal feeling of depression. So a normal feeling of depression is when, let's say, you lose somebody and you're sad. And for some time, you continue to think about this person and it saddens you. But then other things happen and you're engaged in other things, areas of your life, and it is not a daily problem. So when depression becomes a mental illness is when there's nothing else that matters. You are constantly in this depressed mood. You cry for no reason. You're anxious all the time. You have paranoia, you have all these. So these experiences in life that we have faced in the past and we face now, can lead us to lose control of normal coping, the normal coping that is intrinsic in our lives. We are all equipped, we are wired, to be able to cope with life, because life is not just plain sailing. Life is full of different challenges. In fact, that's how we discover that we are strong. When you overcome a challenge, you realize that, yeah, I can do this. When you pass a really hard exam and you put in your effort, you say, you can do it. Whereas someone else is saying, well, I've done everything I can, there's no way I'm going to pass this exam. And you give up and you resort to other ways of coping with this situation. And specifically during this COVID-19 pandemic, many of us were faced with psychological problems. We were anxious, we were, frustrated, we were constrained in one place, And people resorted to all kinds of behaviors in order to cope. And I'm talking about behaviors that are maladaptive, that are not helpful in any way, that in fact create even more problems. So the conclusion really is that we need help. As a community, as a society, we need help all the time. And I love the fact that it's being recognized even within the government circles that, yes, a counselor for every school is a way to equip these young people to be able to cope with these things that sometimes can become so overwhelming and they don't know what to do with them. I think it's also good to bring this around to when you think about ourselves as a vehicle. I know it's a little bit, discordant, but imagine you're a car. You have an engine. The engine is your brain. It drives everything around you. A car will look nice and beautiful, but if it has a faulty engine, it will not function, right? So, you have an engine and it rides for some time, and it needs to be serviced on a regular basis, yeah? And if you don't, then the engine knocks, isn't it? So our brain, every now and again, needs to be replenished, needs to be serviced in such a way that it can keep going, it can be renewed and keep going. So the brain, of course, undergoes a lot of strenuous work. We've already talked about that, bad relationships, financial problems, personal loss, everything. And so this is like the engine of the car being, pushed to the limits. So how do we do this? How do we service our brains? Talk to someone you trust. Talk to someone. I like the young man that talked about his problem of masturbation. And, we're all taken aback for a moment. But think about the power of declaration. When you declare something, it loses power over you. Because it's almost like you're saying, yeah, I'm no longer hiding, under the blanket. And I'm no longer, being afraid of being seen or being known to be this person that does this. Yeah? So it comes out to be a very powerful tool to encourage yourself to replenish yourself. So one other thing I wanted to talk about was, what do you do in your spare time? Think about that for a moment, and if anyone can answer, I'd appreciate. But what do you do in your spare time? Anyone? No? Yes, I see a hand there. Can you shout it out?
I either watch a movie or I pray, speak in tongues, and we move on.
Please repeat that. I didn't quite hear. The mic is not on.
I either watch a movie or I pray, speak in tongues, and move things.
What kind of movie do you watch?
Psychological
What kind
thrillers.
of movies do you watch?
Psychological thrillers.
Psychological thrillers. Is it about people being killed? Is it about all these crimes going on?
It is a collection of many of those, but
Right.
it's basically psychological things.
Right.
Yeah.
So what we are talking about here is that what do you fill your brain with? What do you feed yourself on? That is productive, positively productive. I hear often, and my kids used to say this, many years ago, and my grandkids, I've heard them say this, I'm bored. They call me Shosho. Shosho, I'm bored. And my reaction to them is like, it's your problem. It's your problem. Because we are used to being entertained, externally into you, not from you outside. You see, what happens is that when you take your own resources and bring them out, you develop them, first of all, because you discover, for example, you discover that you can tell a joke and people can laugh. Yeah? What do you do with that? That is, you grow it, you know, because you can see it is healing out there. People laugh. Laughter is a healer. And you capitalize on what you do. But if you are waiting to be entertained and waiting for all these kind of things to be fed into your brain, then you are just inviting all these things that are going to come out in a very detrimental mental health issue. So we feed our brain, our mind with nourishment, with the right nourishment. We keep learning, we keep reading, we read the right materials, we develop, you know, good TV habits. A lot of people watch pornography. That's where masturbation, you know, really thrives very well. Violent movies, you know, people go around getting angry and reacting in strange ways, and they are, why did I even react the way I did? It's because of what has been indoctrinated into your brain. Over time, it becomes very familiar, and it's very easy to reproduce something like that when you are in a situation where you need to yeah. So Philippians chapter 4, verse 8 says that involve yourself with things that are true, with things that are noble, right, pure, lovely, excellent, admirable, praiseworthy. If you fill your mind with the right things, then you are planting seeds that will reproduce things that are healthy. So, a car also needs fuel to move from A to B. Not just any fuel, but the right fuel. So what happens when you put diesel in a car that requires petrol? Also, what happens when you put too much oil, because all these fluids in a car, they have gauges. You know, this is the maximum and this is the minimum. So what if you put too much oil in a car? What happens? The engine gets flooded with oil. So watch what you eat, watch what you drink. So likewise, our bodies need nutrition. Avoid foods that end up poisoning up your body. Eat as much good food as possible. Also, cars need tires changed, don't they? Because, you know, I know my tires need changing. And even in a car, the body needs respraying. Sometimes, you know, all the scratches around. So these two makes the car look new. You know, when you see that, oh, what happened to your car? It looks good. So like this, let's look at this as personal grooming, personal looking after yourselves. I know young people say, I couldn't be bothered to wash. I can wear this shirt, you know, 3-4 times a week. Or I don't have to I make my bed once a week, you know, on a Sunday when I've done the washing. Things like that. Let's look at, you see when you walk into this room, and I know that you understand this the way I do, when someone walks into a room, you look at them and immediately you have an impression of who they are, right? You form an impression. It's either a pleasant impression or an unpleasant impression. And all this is like, you know, the eyes are beautiful because they see everything at the same time. And that as you do that, the brain records everything at that very moment. So it's quite an amazing thing, the way the brain works. So when you walk into an interview and, you know, the panel is there to interview you, they have an opinion. As soon as you walk in, they have an opinion about you. When someone gives you a compliment and says, you look good, or what did you do? That makes you feel good about yourself. And the moment you get that reward, you want to do more of that in order to sustain that feel-good factor. So let's look after ourselves, our bodies and our mind likewise. So mental health problems are not just challenges. They're actually diseases of the mind. And that's where we're talking about stigma earlier on with the other presenters, where mental health is not looked at as a disease. You can cope. Pull up your socks. Sort yourself out. These are the reactions we get when we have something that we need to present. So it is very important that we now look at mental health as a formal, well-researched area of health, or general health, so that it can be given the resources, it can be given everything that this area needs in order to nurture this new, younger generation with the right mindset about mental health. So the world, in this world that we live in, it demands high productivity, it demands high targets, high grades, specific modern lifestyles, So we must all think about allocating resources to establish a culture of mental wellness. This is where our renewed hope lies, that we protect our minds from a harmful environment. We seek help when we must seek help, appropriate help, and we also replenish our minds as we look into this area of mental health. The last thing I want to say, there's a new counseling model that's called Invitation to Change. And it has two factors. It has kindness and science combined together to provide help, support for mental health. So let's be kind to those people who have mental health challenges, because kindness acknowledges that someone needs help, that someone is living a real bad experience, and they need help. A healthy body points to a healthy mind. Thank you.
Thank you very much, Madam Lindisay. I would like to request everybody of us here to give us just 10 more minutes to listen to Mr. Joseph Ajal, because I really don't want him to leave before sharing his story. I believe it's impactful and each one of us needs to listen to him. So let's give him 10 minutes, and then after him, we're going to have a 10-minute break, just stretch and come back. Okay? Thank you. Mr. Joseph Ajal, you're welcome.
A very good afternoon to you all. Thank you very much, Mr. Daniel Luasa and Rona Inembabazi on behalf of the Tukule Foundation, the Office of the First Lady, here represented by Madame Irene, faculty at the Makerere University campus here, and especially the School of Psychology, members of Uganda Counseling Association. I see your General Secretary there, Evelyn Connie Harono, who was my classmate in O-level, S1 to S4, believe it or not. I'm excited, sitting next to my OG after many years. Of course, people like Mr. Adrian Kachinda, who's a very avid mental health advocate. I don't know all the names in the room, and I possibly could never do that, so all I'll say is all protocol observed. I hope I've covered most of the ground. The partners, obviously, Mr. Douglas Luanga with Skills Clinic, the Ministry of Health, especially the mental health unit, our mental health referral hospital, Butabika, and all the other hospitals that support in the treatment of mental disorders and illnesses. Of course, our partners, Rocket Health, whom I know very well, Dr. Davis Musinguzi and his partners and associates in that facility. Really some groundbreaking work that you're doing out there. And of course, our audience, the students, our guests, our partners and associates, the media. Thank you so much for making the time to be here with us this morning. and afternoon actually, and maybe later into the afternoon and evening for those who will be staying a little longer. I was requested by Tukule Foundation, led by Daniel Loasa, and obviously Rona, Ainembabas, who has been our MC this morning, our host, to come and share a little bit of my own experience. And I've been given 10 minutes. In the interest of time, it's exactly 1 minute after 2, so when it clocks 11 after 2, I'll step off the platform. Is that okay? Now, I really want to agree with all the experts here. Now, my background is I am a human resources practitioner, right? And my company is that one over there at the door, whose banner is there, Precision HR. That's the company that I lead. I'm also a certified professional coach. I am the president of the International Coaching Federation, Uganda Charter Chapter. So that's what I do for a living. I'm an 8 to 5 kind of person, but I'd like to think more of myself as an 8 to 11, maybe not even 8 to 5. The nature of the beast is such that you're always working. But that's not my most important job. You might ask yourself, so what is your most important job? It's not what puts food on your table, so what is it that is your most important job? I'll tell you right now. You don't have to guess. My most important job is being a father. I think of all the decisions I've made in my life, and I've made a couple of excellent decisions, a couple of bad decisions, and some really nasty ones as well, which I believe is true for all of us. Some good, bad, and ugly decisions in life. Hopefully a few ugly ones, a few bad ones, and excellent ones for the most part. That's why I'm still here. My being a father, which I started the journey 16 years ago when I had my first son with my wife, was the best decision, in my opinion, the absolute finest and best decision I've ever taken in my life, period. Of all the awards and accolades I've won locally and globally, all the businesses, I'm a serial entrepreneur, all the businesses that I've set up and I've thrived successfully, the ecosystems that I've built, the coaching fraternity, the HR fraternity in Uganda, I served as their Secretary General for 4 years. I serve as faculty at Strathmore University Business School in Nairobi. This morning we had a faculty breakfast with our executive dean from Nairobi here in Kampala. She flew over with the university secretary. They met us for breakfast with the rest of faculty, executive coaches, and teachers and lecturers and so on. All of those things pale in comparison with the role that I play to build the next generation of virtuous men, leaders, my 3 sons, for starters. And by extension, every other mentee, I've mentored over 1,200 young men and women, fresh graduates and students in high schools. Because that's what I do in my job as HR and as a coach. I mentor, I teach, I coach. That's what I do. I'm constantly unpacking people's potential and unleashing them to their sheer highest levels of greatness. But being a father, because I've learned recently that most psychological disorders that present in adulthood at the age of 40, 50, even 60, even 70, or 30 or 20, had their genesis in infancy. Childhood traumas. All the officials in this front seat here, the psychologists and the psychiatrists and the therapists and the, clinical psychologists and counseling psychologists will agree that up to 30 or more % of the mental disorders that you now see in adults is as a result of unresolved childhood traumas. Do you see where it starts from? So if we're not present for our children as fathers and mothers now, we're abdicating our duties as parents to maids and caretakers and coming home drunk every night from the bar. It's your right as an adult to drink as much as you please. But you've brought to this world some young folks, girls and boys, who are looking up to you for inspiration and counseling and guidance and love and care. That hole you're creating in their hearts will manifest when they are 30 and 40 through psychological disorders and psychotic challenges. And they will be sick, they will be depressed, because that hole in their heart was never filled. Ask yourself, why are adults so violent? Why are Ugandans, why do we drink so much? Why are we such a meme country? Why are we such, quote unquote, a joke when it comes to social media? Somebody posts something serious, it's not the serious post that gets viral. It's the person who subtweets it. You know, it's the clapback that becomes now the trending talk of town, and we turn it into a meme, and we joke about it for 24, 34, 44, 48 hours, whatever the case might be. For 2 straight days, we're spending so much time on social media discussing memes, forgetting what is truly important, which is to raise the next generation of leaders. And when it's you now, you're already an adult, so we cannot go back to parent you, okay? So you'll have to parent yourself now. All of you in this room, you're already legal adults. From the age of 18, you're a legal adult in Uganda. So even if your mom and dad are still alive, probably you're not staying with them anymore full time. Maybe you're now working, maybe you're now married, or you're a parent. Do your absolute best. Take care of yourself. I listened to Dr. Nzei, and I was so touched by her speech when she said she loves being a shosho, a grandmother, right, and a mother. It is true. When you connect and bond with your children, those endorphins, those feel-good hormones, you know, let me not get so technical because I'm not a psychiatrist, but those feel-good hormones that you get after exercising, when you get a warm hug from a loved one, they build your immunity and they build your resistance to mental illness. They boost your feel-good factor. You know, dopamine is a good hormone, except if it's too much, then it becomes addictive. That's why some people are addicted to substances, because they keep wanting a little bit of a high, a little bit of more of a high, until they burn out all their neurons. And the same is true for oxytocin. The same is true for all these hormones that help us either feel good or distress us or help us to decompress. Exercise. I will not speak so much about these things, but the reason why I'm here is to share a personal experience, because I have experienced loss at a fundamentally personal level. Now, of course, none of us wants to end up in a mental situation of illness. None of us. Absolutely none of us. None of us. We all want to live a long, healthy, and productive life with good mental balance, without depression, without stress. Of course, stress is inevitable, right? But how we cope with it now defines how capable we are of our mental capabilities or our mental strengths. And that's what I'm here to encourage us to live a life of positivity. As a coach, I'm constantly sitting with clients at my desk and using inquisitive listening and questions. I heighten their awareness to deepen their learning to attain their fullest potential in as short a time as possible. But in doing all that, every time a client presents with a negative thought pattern, I flip the question around into a positive thought pattern. When they present with a loss frame, I flip it around to a gain frame, such that, for example, if you leave home and there's heavy traffic, you can curse and swear all you want and show your middle finger to all the border guys and bash all the taxis. You'll end up with a terrible day because you might get arrested. Or you could just listen to pleasant music and say, this too shall pass. Let me just go to office. You can sit like a lame duck in traffic for 2 hours and still reach office with a good mood, as opposed to shouting at everybody. You see the amount of road rage on the roads today? A lot of us are not managing our mental health. I love again the question our keynote speaker asked, what do you do for entertainment? And somebody said they watch psychological thrillers. ID Extra, for example, is a psychological thriller, isn't it? Whoever said that. Do you know what these things do to your mind? You're constantly watching people who are expressing the triads, the evil triads, as I call them, you know? Narcissism, Machiavellianism, and what's the other one? Psychopathy. Yeah, the dark triads. The dark triads exist. And there are some people who have perfected the art of being narcissistic, psychopathic, and Machiavellian. Very, very nasty people. They wish bad for everyone. They are constantly wishing bad for everyone. And when they hear that somebody has got a problem on social media, they share with every WhatsApp group. That is narcissism, even if you don't realize it. It's a dark trait. How do you fight that? By encouraging positivity. So lastly, my job here is very simple. It's done. My 10 minutes are over. Rona. But I didn't want this to be the focus of this conversation. I want to take away the conversation from Joseph Ajal, who suffered a terrible personal loss, to the rest of us. And now we can take on living a life of positivity going forward. 28th of March of this year, I lost my wife to suicide. She was 37 years of age. Very young, beautiful, enterprising woman. Owned 2 enterprises, 2 successful companies, a great mother, a great wife, a great cook, very loving and kind. But she also had a psychological disorder. She had a psychotic disorder. It was called schizophrenia. And at its infancy, it was diagnosed as bipolar disorder. Later on, we found out it was actually schizophrenia. And she'd lived with it pretty much all her life. We were married for 17 years. So that's why I look back and I say the best thing that happened to me was being a father to those sons. Because now the amount of joy that those boys give me is every reason to wake up positive every day. I could choose to be negative every day because I have 1,001 reasons to be negative and gripe and whine and groan and complain. But I don't. I live my life with positivity and energy and verve and enthusiasm, inspiring the next generation of leaders. Thank you so much for your time.
Thank you very much, Mr. Joseph Ajal. Now you see why I did not want him to leave before sharing. Thank you very much for sharing with us. So we're going to take a break for exactly 10 minutes, and then we're going to convey back here. And we're going to start with, when we come back from the break, our first speaker is going to be Madam Irene Kauma. After Madam Irene Kauma, we're going to have Mr. Dr. Patrick Agurusi from AMREF, and then Mr. MP. Andrew Jock Olanya, and then Mr. Daniel from One Hope, and then we're going to have Newton, and then Katha, then Reverend Nathan, then Elizabeth O'Carroll, and then we're finally going to conclude with Hajat Namujenyi from Makerere University. Kindly let it be exactly 10 minutes, and let's be back here in exactly 10 minutes. Thank you very much for your time. Sorry, I forgot to mention there is an exhibition behind, so kindly check out the exhibition area. And there's also a few snacks from Sam's. Thank you very much, Sam's, and where's Olo? Thank you, Olo, for bringing the snacks. Yeah, let's convey back here in 10 minutes. Thank you.
All right, thank you.
It's not on. Thank you very much. I don't know whether we have any people from the Makerere University Administration, but let me recognize the distinguished speakers and the keynote speaker, and our distinguished panelists. Let me also recognize Daniel Luasa and the team from Tukule Foundation. All of you distinguished participants in the room, good afternoon. I want to thank Daniel so much and the team for taking this very noble initiative. Somebody said, when good men, evil thrives, when good men do what? Remain silent. So thank you for not only speaking up, but mobilizing everyone to come on board and speak up. I'm feeling a bit embarrassed for this big, with support from the office of the First Lady and being told there is no lunch. But since I've been invited to speak, let me not come with a cane. But I've asked somebody to see that at least there is a drink. Okay. And before I talk about purpose, which I was asked to talk about purpose, self-awareness within 10 minutes, and that's not possible. So I'll restrict myself to purpose, and I'll just say a few things about it. But let me just say this before I get onto that. The Ministry of Education and Sports is aware of the escalating mental challenges in institutions of learning, just so you know. And a lot is being done. We have a whole department dedicated to counseling and guidance, and this is being strengthened to make sure that experts go out and provide guidance. Guidelines have just been sent out to schools just to communicate how these challenges should be handled. And one of the main decisions that has been made is that every institution should have a counselor. And we pray that in partnership with all the good people I've found here, Safe Places, the Uganda Counseling Association, and everybody, we hope that we can avert this challenge. Are we together, friends? I put together just a few slides so that I speak to them very fast. Is anything showing on the screen? Or should I just speak? Please, I know the sugar levels are down. I said we are organizing something. Is anything showing on the screen? Okay. Do you see a picture on that screen? Okay, the next slide. Let me hope this will work out because I can't see what is on the screen. There is a picture there of two people. Who do you see? And? Okay, let's have some order. We are at Makerere University. By the way, I should have said that I was here as a student and a resident of Africa Hall from 1990 to 1993. Ooh, I'm so old. Yeah, I've worked for the last 26 years. So I was here so long ago. So you see a picture, and the only person you recognize there is who? And the other one, somebody said a mzee, another one said an old man. Anybody recognizes the other person on the screen? Now the two people there, one of them is President, the former global icon, Nelson Mandela, and the other one is his brother, Maurice Mandela. So what comes to mind when you see those two pictures side by side? Two people grew up in the same environment, probably had the same access to education, probably had the same opportunities around them, and they end up in very different ways. When Morris died, none of us knew. Did you know when Morris passed on? But when Nelson Mandela died, any of you who didn't know that Nelson Mandela had died? So the point I'm making this afternoon, and in the few minutes that I have, is that we must make a decision to live purposeful lives. And it doesn't depend on our environment, on our parents, on what we go through. It is a decision that we make. And we can see it very clearly from those two people. Nelson Mandela and Morris Mandela, same environment, same access to education, but two very different lives. What distinguishes them? One of them made a decision to embrace purpose and live a life of purpose. And purpose is one thing we are always talking about. And sometimes I think it's a tired phrase. People are looking for purpose in books, self-help books. People are looking for purpose everywhere. And I just want us to make sure we are on the same page when we talk about purpose. Purpose is the reason for which something is done or was created, something for which something was created. Miles Monroe says purpose is the original intent of a creation. And let me say this, you don't first create a phone, manufacture a phone like this, and then you say, let's find a purpose for this thing that we have manufactured. You must have a purpose for that which you create. Are you hearing me? There is no manufacturer who goes to manufacture and then finds a purpose for whatever they have manufactured. So because we are created by God, God had a purpose in mind before he created you. So there is no one walking around with no purpose on earth, because God wouldn't have wasted time to create you. He had a purpose for your coming on earth. So we do not run after purpose. We don't pursue purpose. We don't look in books and everywhere. We simply connect to purpose. We simply embrace the reason for our existence. So purpose, therefore, is the why of life. And it's life's biggest question. Why am I here? And thinking about our theme today, renewed hope, when you connect to purpose, when you connect to the why of life, you cannot take your life, however many challenges you face. You can't walk around with a gloomy face the whole day because you have connected to the reason for your existence. Some people refer to purpose as calling, some call it destiny, others call it a unique assignment, others call it your core work, others call it your race. We each have a race marked out for us. So we don't have to walk around feeling hopeless. We don't have to take a substance to feel high. You know what powers me? What makes me feel high? You don't? When I have a speaking engagement. Because that's my reason for being here. I am called to motivate, to inspire, to encourage, to push others to their greatness. That's what I live for. And so even when you send me, I've had a very busy week. We've just had a very big conference, the Inuka Africa Conference. So I'm really exhausted. Yesterday I was in Kapchora the whole day, but I did a teaching this morning at 6:30 to 7:30 without feeling pushed. After that, I came here. Why? Because this is what energizes me. I don't need Daniel to give me an envelope. Actually, if he gave me, I would give it back to him. Because I connected to purpose. And in the few minutes I have here, I want to tell you that you can connect to purpose. Why? On the screen, I have a Mzungu now. I started off with 2 people. You called one a Mzee, you people. President Nelson Mandela's brother, you called him a Mzee. The person on the screen is called Dr. John Edmund Haggai. He is the founder of the Haggai International Advanced Leadership Training in Hawaii. I had the privilege of attending that training for 25 days at no cost. They sponsor you. They look for people who they think can influence others and invest in them so that they can go and be an influence. Dr. Haggai, because he found that purpose, he passed away recently at the age of 96, but he could still drive himself to work. He could still teach. He was still flying the nations until his doctor said, "You are too old. You record messages and send them around the globe." That is the power of connecting to purpose. He has trained thousands of leaders. In Uganda here, there are many people who have been to the Haggai Leadership Institute. So why must we connect to purpose? Purpose gives meaning to life. When you connect to purpose, you've connected to your core work. So you rise up with energy. You are able to do so much. You don't have to pretend around people. There are places I don't waste time going to because they're outside my purpose. I don't have time. I have so much to do. I first of all have an 8 to 5 job. And when I'm not doing that, I have so much to do. Purpose simplifies your life because you decide. It kind of defines what you do and what you do not do. So if you called me here to something that is outside what my purpose is, I would just not even think about saying no. I would just say, no, I'm not able to come. Purpose gives you focus. You focus your energy. You focus your time. You focus your resources because you are doing your core work. Purpose motivates you. Purpose helps you leave a legacy behind. When I put on the pictures, all of you could say, that's President Nelson Mandela. Have you all been to South Africa? No, you haven't. But you know him because he connected to the reason he came on earth. I want to draw to a close. And I just want to talk about 3 P's. How? Because when I talk about this, you're all wondering, so how do I do it? I also want to embrace purpose. I also want to live a purposeful life. 1, please know that there is a process. Young people, there is a process. The journey to destiny, the journey to embracing your core work is a long journey. It doesn't happen in a day. You go through pain. You get trained. You connect to people. It is a process. Part of the people you connect to are called mentors. People who have lived life and can help you not make the same mistakes. And to help me make this point, there is a small video that I want you to just watch, just to emphasize the point that there is a process, like just 1 or 2 minutes. Next slide. Please play the video. There is no volume. Okay. Our technical people are still trying to connect to purpose. So we shall go on. So basically what I'm saying about the process is embrace the process. For Nelson Mandela, it took him 27 years in prison to get to see the South Africa that he wanted. I don't know what burns on the inside of you. It's not going to happen. Maybe, Gloria, you sit and say, I want to be the next gospel singer who will compose all the songs that will be sung in every church here. It's not going to happen in 2 days. I want to be the best Bible teacher. I want to be this. I want to be the best decorator that Uganda can ever talk about. It is not going to happen in 2 minutes. Friends, there is a process. And I deal so much with young people because of my office. And so I carry this burden. I want to shout on rooftops and say, please know that there is a process. One time I had a young man who came and said, the First Lady must come and officiate. I have this huge idea. Let her come to Africana. I've organized, I did everything. We reached there to an empty hall. And I'm not exaggerating. We reached at Africana Hotel. It was a breakfast meeting. And I have lifted the whole First Lady to this meeting because I want to support my young friend. There was an empty hall. There were just a few people scattered around. And I gave my friend some feedback, and he wasn't even listening to me. He was talking to so many other people. So after a week, he came back and told me, I want you to help me invite Michelle Obama and Oprah Winfrey to come. I'm organizing a big conference. I said, please get out of here. So we are not saying don't dream. Are you hearing me? But please know that there is a process. Embrace the process. Subject yourself to training. Be humble enough to serve. Be humble enough to serve. Those who read scripture, there is only one way to greatness, and that way is, if you want to be great, learn to be the servant of all. That is the only way to greatness. So young people, look for ways to serve. Find ways to serve mentors. Find ways to honor authority. I have worked with Mama for the last 12 years. I worked for 14 years at the Directorate of Immigration, at the Directorate of Citizenship and Immigration Control. I have 3 degrees. I have 2 master's degrees. I have a lot of experience in government, but there is nothing I will not do to serve her. Nothing. I will not sit and say, I have my degrees, I'm here, this is my job description.
Nouvelle génération wants to break through without suffering.
What do we
Ils veulent réussir sans souffrir. They want to break through without mentorship. Ils veulent réussir sans mentor. They want to break through without being led. Ils veulent réussir sans être dirigés. They want to break through without going through the process. Ils veulent réussir sans passer par le processus. Because social media can make you popular. Parce que les réseaux sociaux peuvent vous rendre populaire.
Everybody goes to like it, so
Tout le monde vient like
that you are
donc,
up there.
Tu penses que tu es au top.
But if you haven't been through the
Mais si tu n'as pas passé par le processus,
you will fail at the top.
Tu vas échouer au sommet.
You can't skip it.
Tu peux pas l'échapper.
When we were growing, we had no social media.
Quand on grandissait, on n'avait pas de réseaux sociaux.
So we went through mentorship.
Donc on
We
est
had
passé par
people
des
we looked up to,
mentors. On a des gens qu'on
people
regardait.
that we called our fathers,
On
that we
appelait
looked, when they
papa.
said no, it was
Quand ils
no.
disent non, c'est non.
This new
Cette
generation,
nouvelle génération,
when your mentors are saying no,
quand
they
ton
say
mentor
yes,
dit
I'm
non,
doing
ils
it.
disent oui, je le fais.
Because I have this kind of view. And
Parce que
that's
j'ai tant de
why
visions
most of them cannot get to a
C'est
certain place,
pourquoi certains d'entre eux ne peuvent pas
because they
arriver au
haven't
sommet.
taken time to learn
Parce
through the
qu'ils n'ont
process.
pas appris
My advice to the
d'étudier
generation
le
is
processus.
find a mentor.
Mon conseil, trouvez un mentor.
Humble to serve.
Sois humble pour servir.
And wait for your time.
Et puis attends ton temps.
And when it's your time,
Et quand c'est ton temps,
nobody can stop you.
personne ne peut le stopper.
Thank you so much.
Very well said. Wait for your time. Find a mentor. Humble yourself and serve. When it's your time, no demon, no one will stand in your way. One of the issues we have today is we are too impatient for success. We are too impatient for success. You have a whole life ahead of you. You have endless opportunities. Sit down, learn, so that when you're manifested to the world, everybody will say, wow, because you have been trained. I was making a point about my service with my current boss. One time, we traveled out of the country, and there was no household staff to do the job that household people do. And so we get to this mall, and she wants to use the bathroom. So I ran ahead and clean it, because I don't want her to enter a dirty bathroom. Is that my job? It's not. But I saw her look at me differently. She was pleasantly surprised. Young people, serve. You want to be great, learn to serve. Look for ways to serve. If I sat in the office today and my boss was in the office up to midnight, even if I have a meeting anywhere else, I will sit there up to midnight. So don't run away. I have this, I have that, that is secondary. Embrace the process. The potential we have in Uganda, that many young people can be a great asset to this nation if you all follow the rules of engagement. If you miss the process, you won't manage the pressure at the top because you have missed the process. I'll make the second point, the price to pay. There are three things I'm talking about: the process, the price. Usually, there is a price to pay. For Mandela, he didn't wake up and he was this global icon and everybody is wanting to travel the world to see Nelson Mandela. He paid a price, 27 years in prison. He spent years because they wanted to really torture him. They gave him a job just to, what is that? Knocking stones, doing meaningless work, just so they kill your spirit. So when you see him there and say, I want to be Mandela, my friend, are you able to pay the price? You remember the sons of Zebedee? Any Bible readers in the house? The sons of Zebedee mobilized their mother to go to the Lord Jesus and say, permit that my sons, these ones, one will sit at your right hand and the other at the left hand. And Jesus said, can you take the cup? Can you drink the cup? Can you? There's a time I went to speak somewhere and a young person ran to me and said, I also want to be an assistant like you. You're smart. I almost asked her, can you take the price? When the country closed, when COVID came, we spent 2.5 years at our place of work. We were not going home. 2.5 years. Essential staff. Can you pay the price for greatness? Or you think that because now you have got this appointment and now you have the other connection, you have arrived. There is a price to pay. There are days of loneliness. There are days of alienation. There are days of too much intrigue. Palace politics, there is so much. So by the time you see a person emerge and you want to be like them, there is so much they have been through. Young people, if you're going to connect to purpose, you must be willing to pay the price. The last P is potential, and I want to talk very fast about that. And again, I have Cheptegei. Cheptegei there doesn't just sit in his house and wish and maybe pray and fast for 40 days. He trains every day. Listen to me, every day. He's on a strict diet. He doesn't go to drinking places. So when he goes and brings a world record, he has paid the price. But I'm talking about potential now. We have potential, each one of us. God doesn't call us to fulfill purpose without wiring us for that purpose. God has wired each one of you. You only need to tap into that potential within you. And that potential comes in the form of a shape. The acronym SHAPE there forms everything. God has given you gifts. Find out, what are my gifts? What am I good at? God has given you the heart, passion. What are you passionate about? What are those things that keep you awake? What are those things that you cannot afford not to do? Connect to that. What are your abilities? We have special abilities, things we do with minimum effort. What do you do with minimum effort? It points you to purpose. Then your personality. I'm an extrovert. I talk even when nobody wants me to talk. But that is part of my assignment on earth. Because what I came to do involves talking. Are you hearing me, young people? I remember going back to my grandmother when I was 14, and I wanted to preach. I wanted to be the preacher in church. I told her I want to be the one to preach on Christmas. She said, "Shut up. What do you know?" I said, "I know the story of Noah and the floods. I know the other one. Please just allow me to preach in church." She said, "Sit down and shut up." Nobody could allow a 14-year-old. Now today in that church, when I go, if the reverend sees me across the road, he asks, "Are you ready to preach on Sunday?" What am I explaining? They are those things you're passionate about. Don't push them away. They point you to purpose. There are people who will see street children and they cannot sleep because your purpose is connected to them. I liked what Dr. Nekesa said. She said, "I went back to study so I could come and help these people." That is purpose. Purpose is more than fame. Purpose is more than wealth. The fulfillment that I get from motivating, from inspiring others to greatness, no money is enough to pay for it. And no money can make me stop doing that. So connect to your shape. Your spiritual gifts, your heart, passion, your abilities, your personality, and your experiences. E stands for experiences. The things you have been through all point. We had Mr. Ajal here, motivating us. And I told Daniel, this is enough for me. Let me go. I'm encouraged. God is not a sadist, young people. When he allows bad things to happen to us, it's because he wants to use them. They are part of your purpose. You've been through a divorce, you've been through a mental problem, you've been childless, you have failed at campus. You are the right person to stand and encourage other failures, not one who has succeeded. So connect to purpose. Jim Collins calls it the hedgehog concept. The intersection, Jim Collins has written a book called From Good to Great. And he says, for you to move from good to great, you must find your hedgehog. And that hedgehog is the intersection of three things: what you are passionate about, what you are very good at, what you can possibly be the best in the world at, and what powers your economic engine. What is that thing that can help you make money? I'm trying to package my speaking gift to help me create wealth. And I am doing that. I have registered Hill City Consult. And so now when you invite me, I'll send you an invoice from City Hill Consult, Mr. Luasa. Yeah? So, finally, you all have purpose. The Creator had a purpose in mind before he even created you. You don't run around looking for it. You don't frustrate yourself looking for it. You simply connect to it. And I've mentioned 3 P's, and that is process, be willing to pay the price, and tap into your potential. And the potential comes in the acronym SHAPE. So where will you make your impact? Society has given us 7 mountains of influence, and each one of us is packaged to impact one of those mountains. Government and politics, is that what you want to impact? We have Honorable Andrew Olanya, and I want to recognize your presence in our midst. He's saying, let me go and impact this mountain. Are you going to impact the mountain of education, economy, business? Are you going to impact the mountain of family? Are you going to serve in church? Are you going into entertainment? Are you going to the media? These are all mountains waiting for us to impact. So there's a lot of space. Don't be impatient. There's so much space. Just connect to what God has called you to do. I want to close with a video, if it can play. Very short, and I'll sit down. And this is by Mensa, Dr. Mensa Otabil.
And let me just even be bold to say,
Can
it's
you
not
start
favor.
from the beginning so there's context to it? Sorry.
Anytime you see a person who is doing anything exceptional, it is not luck. And let me just even be bold to say, it's not favor. It's not favor. It's not grace. God is not selective with grace. God's grace is abundant to all. But there is something called frustrating the grace of God. Being graced by God is God's investment in you. Being disciplined is your investment in yourself. When Paul is saying, I can do all things through Christ, he's not talking about grace. He says, he's talking about discipline. He says in a race, the reason why people win is because they are temperate in all things. Never look at somebody who is exceptional in any field and just say, God has blessed you. That is the lazy man's observation. If you believe where you are going is far, then what you load must be deep. You can't believe God is sending you on a far journey and load yourself light. Your tank must be full. And you must be in charge of everything that is required for you to be that kind of person God wants you to be.
Amen. You can be that kind of person if you connect to purpose. Thank you for having me.
Thank you so much. That has really been a very incredible presentation, most especially on the life that we live today. I would say that at the end of this summit, we have a take-home message. And the take-home message that we have taken from Madam Irene is we need to live a life of purpose. How do we live it? We need to take the process. And taking the process, it needs our souls. So at this moment, I would still request to give still a hand of applause to Madam Irene for that incredible presentation. Thank you so much. I have seen actually a picture of Nelson Mandela. I have been one of the person that actually had a lot of beliefs in society that I can be one. I come from a very marginalized community, that is Karamoja region. When I joined Makerere University for veterinary medicine, the first day I had a lecture, the introduction was done by everyone. So when I said, I am Lotiang Elia from Karamoja, my professor said, wait. I was almost exiting the door. Yes, I was too terrified because I know my community is known for maybe cattle raids and insecurity. So I thought maybe the man said that your community stole his cows. So I was almost exiting. So he said, no, I have waited for you, young man. I said, why? Because it takes me, even years, to get a person to be recruited in this course. And finally, I took his word, where he told me, don't take this class as your world, but rather make the world your class. 3 years, when I was in my third year, I contested for the college president, College of Veterinary Medicine, and I won by 76% of the votes. So I went to his office, and I said, Professor, I am now a president of your college. He said, wait. I said, this time I'm not running out. I'm not thinking. He said, well, I'm just saying wait such that I can call someone to prepare a table such that we have tea on a round table. So that was really a lived experience. Not only that, still when I went to my 4th year, because of the services that I did as a college president, as a council of the college president, I was able to be the Prime Minister of Makerere University. And actually, up to now, I'm receiving awards because I'm the first Karimojong to be a Prime Minister of Makerere University. So, what is remarkable about me is when COVAB was celebrating 50 years of existence, I was a college president. When Makerere was celebrating 100 years, I was a president. So, a Prime Minister. So, when actually Madam Irene talked of a purposeful life, I really feel like, I think mostly it's not about who we are, but it's about what we do to others. I think it's good to make a start from there. So at this moment, I would love to have our next speaker, that is Honorable Andrew Olanya, MP Omoro County. Thank you so much.
Good afternoon. Kindly allow me to keep the mask on because I have a bit of a cough. I don't want to leave any pieces of me here. My name is Ojoka Andrew Olanya, and I'm the Member of Parliament for Omoro County in Omoro District. I've been an MP for about 3 months now. It feels great. The organizers, I want to thank you very much. I want to thank you, Rona. I see Isaac is here, I see Sharon, I see the whole team of Tukule Foundation, and all the partners. I want to thank you very much for this opportunity to just share a bit. I've been given 10 minutes, and I'm happy that Rona didn't give me a topic because she left it open for me to discuss. So I won't be as open as possible. So Omoro County is in northern Uganda, and the poverty level at the moment is at above 68%. So the issues of poverty, of economic hardships and the like are prevalent. So issues of mental health, I'm sure, would really help in seeing how we can tackle that. I became an MP after the death of my father. So it was a tricky time for me. And now to be speaking at a mental health summit, I think it's a sign from above. Coincidentally, next Monday starts school in Makerere here. So I don't know if it's still a sign that I need to have my mind checked, but I'll be doing law with effect from Monday, from Makerere. So my message is simple, that just as Irene has already shared, it's critical that you know yourself. So my first law is know thyself. Know yourself. Because if you look at what General Sun Tzu wrote in the Art of War, he said, if you know the enemy and know yourself, you need not fear the result of 100 battles. If you know yourself but not the enemy, for every victory gained, you will suffer defeat. If you know neither the enemy nor yourself, you will succumb in every battle. So the first thing is in knowing yourself. So I agree totally with the idea of purposeful living, that know why you're created. Otherwise, every route takes you to where you want to go. You need to know why you're created. And a few ideas have been suggested, that you can have prayer, you can meditate. There are things that have been shared, but I'm not an expert in that area. But you can engage a specialist in that regard. One of the challenges that I've noticed with our current youth is that we speak before thinking. We actually tweet, we share, just for the sake of likes. We're in the meme economy now. Anything goes. It doesn't matter how crude, how uncouth it is, as long as it sells. So I say this because I went through it when my father was ill. When he was sick and was really fighting for his life. And as usual, we're active on social media, but you come across really negative comments. There are those who are saying he's deciding between purgatory and earth, he's still deciding. Some really bad comments. But if you know yourself, then some of those things can't hurt you. You can break down if you don't know your strengths or your weaknesses. So it's important that we know ourselves first. So I'm going to just share a framework that I use. It's based on a book by Don Miguel Luis, a Mexican surgeon who became a spiritualist, and the book is called The 4 Agreements. So based on the 4 agreements that I use as my framework, really, on how I tackle some of these issues every day. The first one is that we should be impeccable with our word. Be impeccable with your word. Basically, here saying, make sure your word has no sin. If I make a commitment, can I meet up to that expectation? If I say I'll do it, can I do it? For every word that you speak can either be a blessing or a curse. So for a child, if I tell you you're stupid, and you believe it, that's an agreement already. So you spend your whole adulthood trying to fight that agreement you bound yourself with when they call you stupid. When I call you short, like all those negative comments, so you can either agree or disagree with whatever they're saying about you. The second one is that do not take anything personally. So we live in a society where you have people who are learning, they're figuring things out as they proceed with their life. So no one is perfect. No one knows everything. So if a person tells you you're smart, it's a positive comment. But it doesn't make you any smarter than you are already. So Ron, if I say you're smart, it doesn't mean you're not smart before. It's a positive comment, so you can take it. But if I said the contrary, it can spoil your day. And yet, it's not about you. It's about how that person perceives you. So the issue is not you, it's them. So as long as you disengage yourself from the comment that is being repeated to you, I think you can save your mind a bit. Thirdly, do not make assumptions. We have young men and women in this room. So if I look at a girl, like the lady with the nice hair, and she smiles at me, my assumption is she likes me. Okay? So in the great scheme of things, I have already, what the youth call vibed. In my mind, I've vibed her. I've already prepared my marriage to her. I even have children in my mind before I've uttered any word. Now, if this goes on for a month or two, and you haven't done anything about it, and then my brother goes and makes a move and takes the girl. Now, in your mind, you feel betrayed, but you haven't mentioned anything to her. So let's not make assumptions. So communicate, because this also happens in marriages. In your marriage, you might assume that your partner knows what you're going through. I've been married, I'm in my 5th year now. We got married in 2017. So you might assume that your partner knows what you expect of them, unless you tell them. So you end up with frustrations that are uncalled for. So it's important that we communicate. Do not assume. Then lastly, always do your best, regardless of the situation. So today you might be sick, but do your best in that circumstance, because that will rid you of any guilt. This happened to me from November. I used to work at a government institution called NITA Uganda. They regulate issues of ICT in Uganda. Now, when my father fell ill, because he was a public figure, and you want to keep some things private, I was taking care of him, and I could not tell my supervisor that my father was ill. So I had to burn the midnight candle. So during the day, you take care of your father, but also in hospital, you have a laptop with you, trying to see how you can solve all those other issues. So in the circumstance, I felt I was doing my best, but I was getting burnt out as well. Things I didn't even know I was going through. So people, of course, observe, but in your mind, you have no regret because you've done your best. you know you have done your work, you have taken care of your ill parent. Because the worst thing you can have is a regret about something that you could have done when the person is no more. So you do your best regardless of the situation. So that in a way clears your mind from the guilt that is associated with bereavement. It's a bit tough, but I have three areas that I thought I would also share in addition to those frameworks. And I like what the gentleman shared. Much as this is a public forum, I even know that this session may be recorded. I know you can be trolled online. I know people can abuse you. All those things could happen because of what you said today. But this question is paramount. So the question is, who are you vulnerable to? Who are you vulnerable to? Usually the strongest men are usually the ones on the verge of suicide or death by suicide. Not committing suicide, I was corrected today. So usually the strongest are the ones on the verge of depression, the verge of anxiety, the verge of all those other disorders that we talk about in terms of mental health. So it's important to get someone that you're vulnerable to, that you can share your weaknesses with, that you can share your challenges with. It's important. Secondly, forgive yourself and those that might have offended you. Because most times we carry a lot of baggage from the past. If you read the Bible, they tell you that forget the things of the past because God is doing a new thing in your life. So as long as you carry that baggage, your vessel is full of baggage. Let it go. So forgive yourself and those that you might have offended, or those who might have offended you. Then lastly, you're a work in progress. Cut yourself some slack. Thank you very much.
Thank you so much, Honorable Andrew Ulanya Ojok, for what you have really shared to the young people today. And I feel that they will never walk as they walked in this room. So they will walk as different people. And I think a lot has been shared, but mostly I think it's about the life that we live in communities. Just to say something is, we had East African Integration Symposium in Arusha, where I led a team of Makerere University. And one word that I copped up and I picked from the community of Tanzania was the Bantu word. I think this is the Angoni word, which says, Umuntu, Ngamuntu, Ngabantu. I'm not a Bantu speaking community, but I can speak. Okay. So what does it mean? I am because you are. You are because I am. We are because we are. So it's really a time that we really focus, most especially on the community. So I also recognize Grace Rukundo, a member of Tanzania, who really welcomed us and gave us atmosphere. Thank you so much, Grace, for attending and honoring this function. We shall have a communication, or this is more of a story from Angela Nsimbi, and I'm aware that many of us and everyone outside there has ever heard of Angela Nsimbi, and I think there is only one word that she's described, that she's a mental psychologist, and she's also a survivor of mental health disorders. A lot has been told about Angela Nsimbi. She's the founder of My Story Initiative, and also she's the founder of Heart to Heart Shirt. I must tell you that she's a mental health activist and award-winning personality in terms of mental health and also journalism. So a lot is going to be shared by her, but I can't really talk of her biography because there is really a lot in black and white, but she can speak in summary by herself. So let's take this opportunity to welcome Angela and Sivi and give us that inspirational talk. You're welcome. Thank you.
Thank you. I had to adjust this mic, Bambi. I'm very short. Okay, I'm happy to be here. I'm a mental health activist, an author. I came with a few copies of my book. I actually had the launch on Monday, World Mental Health Day. And I'm here just to share a bit of my story and to equip you as young people on how to cope and not to lose hope. I really like the theme. I wish she was still around. I wish Irene was still around, because when she was talking, I was actually taking notes. And it's so amazing. The truth is, you can never find your purpose before you go through pain. That is very true. Because when I had the breakdown, but before I even go there, I just want to say something. It's a saying, the home is the first university and the parent is the first professor. The truth is, most of our lessons we learn from home. And we learn how to love, we learn how to cope with stress by watching our parents. Because your mom or dad might tell you one thing, but they are doing another. So personally, I grew up in a home, there was a lot of conflict in the home I grew up in. And my mom and dad, it was very rare to find them having a civil conversation. It was about quarreling. Somehow they wouldn't agree. And I didn't like the way they resolved conflict. I found it very unhealthy, and it affected how I also resolved conflict when I grew older. Because when I grew older, I thought keeping quiet about things is the best way to sort it out. Because I'm not really a quarrelsome kind of person. I would rather confront the issue, deal, and move on. But sometimes I found myself in a place where I was keeping quiet. And most of this stress I found within my marriage. I was keeping quiet, and I was hoping things will be fine. And it was quite challenging. But even growing up, however, growing up, Bambi, I used to fight. As in, I would get the physical fights with my brothers. I have 3 younger brothers. They are just about a year and a half older than me, just slightly under 2 years. I mean, younger. So when I would have conflicts with my brothers, that one I would deal. I would beat them thoroughly. But of course, when I grew older and they also grew older, I realized that's not the way to resolve conflict. So what am I saying? Keeping quiet eventually got me sick because I started having negative thoughts. I started getting restless eventually and losing interest in what I love doing. And I became overwhelmed because I was a young mother at the time, and I was a mother of 4 at the time. My youngest child at that time was 9 months when I had the breakdown. I also didn't understand what was happening to me because mental health issues, we are not very comfortable to talk about them. And if you suspect that you might have it, you are also scared. There's what they call self-stigma. You are scared and you're wondering, am I really off? You know? And then the way also people around you are walking around you, giving you the medication you need to take, you're saying, it can't be. So obviously I was in denial. I won't lie, I was in denial. And it took 2 years. I went to see a psychiatrist. It took 2 years before even the psychiatrist told me what they were treating. So my background, I'm a journalist. I've done journalism for over 20 years. So I asked questions, because as journalists, we are trained to ask questions. And I asked the doctor, what are you treating? And I remember the doctor telling me, we are treating this thing they call bipolar. And he drew me a diagram, I remember, with a valley and a hill, that when you're depressed for longer. When you're excited and it's for longer, and it's disruptive. So in simple terms, that's how he described bipolar to me. And at that time, I was told it's a bipolar affective disorder. So, and he was telling me, you're going to live with this stuff for the rest of your life. Now, you guys, as you listen to my story, this is my story. Doctors have other ways they deal, but this is my story. I just decided that this is not my portion for life, because for me, I'm born again, I'm a Christian. I decided it's not my portion for the rest of my life. Yes, I'm going through a season, and I'll get over it. I didn't know how long it would take. My oldest child at the time was 9 years. So you can imagine my 9-year-old, she was young. And then you have a 9-month-old baby. So they were really young. And actually, I didn't even have a maid at that time. I thank God I didn't, because she wouldn't have managed either. So I had to learn how to cope. Of course, I went through the medication. I remember I was knocked out. I was given medication. I would sleep, wake up, like that for at least a week. And I remember my husband had to take time off for him to take care of me the first time. And during that time, I remember when I had to talk to the nurse the doctor, and there were student nurses. There's a nurse who laughed at me as I was talking to the doctor about what I was feeling. So that's the first time I confronted stigma. And I remember telling that nurse to stop laughing. Yeah, I told her, don't laugh. What is funny, you know? And after that process, I realized that I need to pick myself up again. Because the truth is, if anyone here in this room has ever gotten a mental health crisis, if you've ever got a crisis, it's like you are learning everything all over again. You hit rock bottom. If you are confident, you have to relearn confidence. If you are somebody who was an extrovert or whatever, everything you are relearning, because you are already afraid. You are so insecure around people. And the nature of my job meant I have to go out there and speak to people, and I didn't want to speak to people. It was a very hard process. So I had to also turn to the Bible. There are many things I used. I went to hospital, the medical model. I was on psychotic meds for 5 years. I started to read the Bible more, and I decided to start ministering to myself through the Bible. Because as young people, I know when you're growing up, people call you names very much. People call you names. Someone can say, you'll never amount to anything. What value can you ever add? And I mean, people talked, and it hurt. And so I started to affirm myself through the Bible. My favorite verse is Psalm 139, verse 14, that I'm fearfully and wonderfully made. I needed to say that to myself over and over again. I needed to affirm myself that I matter. Because when people told me I didn't matter, it actually affected me. And yet, by the way, those who know me, they always saw a cheerful Angela. I was always smiling, always. I just didn't want people in my private space. I never talked about personal matters. So actually writing this book is a step of obedience, because I was instructed in my prayer closet to write the book so that people are able to be supported. And as I'm trying to summarize, so I want to read something from my book so that people can understand how do you cope. This is on page 151, and the subtitle is Pursuing My Own Healing. Although my father would affirm me during my childhood, in my adulthood, I had to get affirmation from my Heavenly Father through the pages of the Bible. A father is a covering. A father gives one identity. The father effect is crucial in giving a person identity. What better way than to receive the covering of my Heavenly Father? I chose to be an eagle in the storm. Drawing from research I did online, when eagles turn 40 years, I know most of you young people are not yet there, and you think, oh, 40, when will I ever get there? But yeah, you'll get there one day. So I'm continuing with the excerpt. They are faced with a decision of dying or surviving. Sometimes, regardless of what age you are at, there's a time when you will come to that place where, am I going to survive or am I dying? Apart from surviving, I include thriving as well because it's an important aspect of healing. The reason why an eagle is faced with this major decision is because its wings have become too heavy and it finds it difficult flying. And I want to kind of relate it to everyday life. Sometimes the things that weigh us down, maybe it's a relationship with a boyfriend. Maybe it's an incestuous relationship happening at home and you can't dare talk about it. Maybe it is a rape. Maybe because also young men are at risk. Maybe someone sodomized you in your childhood and these things have become heavy. You can no longer move, it's heavy. So back to my book. The eagle's beak has become too curved that it cannot pick its prey easily. Its claws are too curved that it can't hold its prey. Bottom line, the eagle must do something to remain relevant, survive, and thrive. It flies to that mountaintop where it spends 5 months rebranding. There comes a time in our lives that we need to rebrand. I already told you I was in journalism over 20 years. And actually, during that time, I had my crisis. I actually had it twice because the second time I had a relapse, I was a mother to my 5th child who was just 4 months old. But I had to get to a place also I needed to rebrand myself. It hits its beak against a rock until it breaks, which is a painful process. You can never get to that place of purpose without experiencing the pain. I could compare this to what I was experiencing during my journey of recovery. I had to hide myself in the rock who is Jesus. The process of rebranding continues. When the new beak grows, he uses it to pluck out these claws. After the new claws have grown, it uses them to pluck out the old feathers to enable new feathers to grow. For the ego to rebrand itself, it is not a day's event. I have learned that we all have to remain committed to the process if we desperately desire transformation in our lives. By the time this process is done, the ego has a new lease of life of between 30 to 40 years. Then it is ready to soar to even greater heights. This is how God keeps renewing my youth. Yours too can be renewed. So just to encourage the young people out there, in case you have had issues with your mental health, you are not a label. So for me, when I'm introducing myself to people, I don't say I'm bipolar. I'm not a disease. I'm not a disease. I maintain that. I'm not. So you are not a disease. You are not a label. You are a human being first. And I'm looking forward to you people at university having spaces where you can speak about your issues, where you can be vulnerable, having what I call peer support groups, because there's one I started. Having peer support groups where you can talk about the challenges you are facing, because some people are too embarrassed to talk about the shame of abuse. And I just want you to know that as I explain mental health, I'm concluding. Mental health basically is because some people think mental health is a disease. Everybody has mental health, whether you have a disorder or you don't. It becomes mental ill health when you are ill. Mental health, according to World Health Organization, is a state of well-being in which an individual realizes his or her own abilities, copes with the normal stresses of life, and can work productively. So, in a nutshell, everybody is vulnerable. No one can say they are not vulnerable. As long as you have a brain, you are vulnerable. Let us learn to speak up, let us learn to share, and let us learn to stand with each other, and let us open even our churches so that our churches can start to deal with the issues at hand, because we need the children to be in those safe spaces. Yeah, thank you for listening to me. My book is available for sale for people who want to buy at 50,000. Thank you. And thank you to Kule for inviting me. It's a pleasure.
Thank you very much, Angela. I think I'm usually very inspired by the ego story, because I really do believe it takes commitment and resilience to actually attain the change that you want in your life. Coming up next, we're going to talk about reproductive health. Due to the interest of time, I would kindly request all the people talking about reproductive health to come up. They're talking about reproductive health, but with different topics. So I'd kindly request Dr. Patrick Kagurusi to please come up, and Reverend Nathan and Humphrey Nabimanya, please all come up, and we'll be sharing interchangeably. If possible, we'll do this in 15 minutes, then you guys are free to ask a few questions, and then we'll get to the next thing on the program. Dr. Patrick Kagurusi is I think each of them is going to introduce themselves for the benefit of time, and then we'll proceed from there. Thank you very much.
We start with the introductions? Okay. Hi, everyone. The energies are low. I don't know why. Thank you. You know, issues of reproductive health, they're a bit scientific. So if we don't have proper ways we can be able to address them, would love to make you laugh, smile, but also at the same time ask as many questions as possible. As the moderator said, or the host, to introduce ourselves, I'm Humphrey Nabimanya. I'm an alumni of Makerere University. Thank you. And I'm the founder and CEO of Reach a Hand Uganda. I'm really happy and honored to be here. Thank you so much.
Good afternoon. I am Dr. Patrick Kagurusi. I am the country manager for Amref Health Africa in Uganda. I am an alumni of this university. I used to stay in the university hall down there. And I'm very excited to be able to speak to you on issues of reproductive health and mental health. And I'm hoping we enjoy this session.
Good afternoon, everybody. Reverend Nathan Mugalu, those are the names. I am a counseling psychologist, but also Executive Director at Family Salvation Foundation Uganda. I am the only odd man out. I'm not an alumni of Makerere. I come from Kyambogo University, that's where I've been. And also Uganda Christian University, Mukono, and other universities abroad. So a villager like me coming to the great Makerere, it's a privilege. Thank you.
Okay. I don't know whether you'd like to say something before we proceed, but as she comes, really, I want to take this opportunity to thank Tukule Foundation for inviting me to speak to this very noble conference, to thank my distinguished panelists, and perhaps with her guidance, I'll proceed to say a few things, just to create awareness on issues of sexual reproductive health and mental health, and then we shall move it from there through a discussion.
I'm sorry for not actually outlining what you can concentrate on. So you generally going to talk about reproductive health and how it affects our mental health, or how it can actually boost it, how we can be better by recognizing our mental health, being aware, and working our mental health and our reproductive health go hand in hand for the betterment. And then Mr. Humphrey, you're going to talk about the youth rights and the sexual reproductive health, because you have seen your work about contraceptives, encouraging girls and boys and teen pregnancies. So these are things that you're usually very passionate about. So I think that will be the best area for you to cover, if that's okay. And then for Reverend, I've seen your passion for boy child. So I was hoping you can advise in that regard on how the young men here can take care of their mental health, because most of us, there's a very confident gentleman earlier who shared about his issue with masturbation. So a lot of them have challenges with pornography, masturbation, and other challenges that really young boys do face every day. So if you not mind, you can also expound on that. Thank you very much. So we'll start with Dr. Patrick Grossi. Thank you.
Yes, thank you very much. I'm glad to say a little bit about AMREF. AMREF is a health development organization working really on health systems, creating a lasting health change for communities at the last mile. And we've been in Uganda for about 35 years, but very old in Africa, being around for about 65 years now. And we work a lot in partnerships to really try to improve the health and productivity of communities. Now, reproductive health, very simply, is the complete well-being of the reproductive health functions of an individual, and not just merely the absence of disease. So if you know the health definition by WHO, every other tries to plug in, just as you heard about mental health. As we get created in our mother's wombs, our reproductive health functions also actually begin, because that's when you start forming in terms of body, the reproductive health organs, and the hormones, and then you get born as a child. When you get born, society and your parents will be concerned about whether you are a male or female, and that's why a message goes out: she has had a boy or a girl or a baby girl. They want to see, everybody looking at the baby wants to see the reproductive health, reproductive organs well formed, what's the size. And then as a child grows up, you are also looking at how a girl or a boy is actually developing. And mainly looking at the organs and behaviors. And when you grow up into an adolescent, then there is an enhancement of your reproductive health system. Girls will have breast enlargement, they will grow hair on the private parts, and they go into menstruation, and that forms the growth and development of reproductive health organs as you see them physically, but also mentally. They are being nurtured externally by their parents. This is how you behave as a girl, this is how you behave as a boy. And then as you also grow inside you, there are hormones, male hormones or female hormones that are also increasing. And those are the ones that lead to the physical manifestation of your reproductive health. Then for the boys, still the same, deepening of the voice, growing hair in different parts, beards, and really how you shape up muscles while girls are growing calves and so on. And then as you enter into early adulthood, if everything was going properly, then you get into the actual sexual reproductive activity. You have sex, you have children, and then as you again advance in early, maybe late adulthood, if I should say that, you are in the mid-age crisis. What have I done in my reproductive health life? Have I had enough children? Are they doing well? Am I fertile enough? For those who don't have children, why am I not having children? And it's a big crisis. Now, when you go to old age, you find yourself battling with things like cancers of the breast, of the cervix, for those who are unfortunate to get those conditions. Now, on that life course of growing up, you are challenged by different things. Speaking specifically to this audience, there are concerns about how do I look, for example. Am I having enough carbs? Do I have enough muscles? Am I appealing to the opposite sex? How about trying out sex, having some relationships? So those issues start coming up. Now, when those start happening, if you find yourself in a situation where it is to the contrary, and you feel you're not well-shaped enough, you're not appealing enough, then you start getting anxious. If a relationship is not working, you get into depression. And this can be to different extents and might lead to even you trying to end your life, if it's that extreme. So this reproductive health development leads to it affects your mental health because you really start getting those concerns. When you go into, again, motherhood or fatherhood, you try to check how fertile I am, I've delayed to get a child, or the child has come too early, what do I do? Again, you start getting concerns that lead to, of course, panic, anxiety, and so on. But there are also other physiological things. For example, issues of menstruation. Sometimes the menstruation will be maybe too small, too long, painful, and this leads, with that menstruation, the hormonal balances are also ongoing. And you find yourself a bit stressed, or because the menstruation cycle, which is managed by hormones in your body, is actually causing also some mood changes. So you find yourself sometimes not happy, of course, sometimes enduring pain, and then that, of course, affects your mental health. Somebody here very well spoke about the hormones of excitement and hormones of depression. When you're experiencing a lot of stress, those hormones also are thrown out of balance. And what that means is that if you've been having a normal menstruation period, for example, for girls and women, and there's an environmental stress, that's going to affect actually how the menstruation period will go. In adulthood, if you are experiencing a lot of stress, you're also going to have seasons of infertility because the fertility hormones actually tend to drop when you are affected mentally. So the purpose of the little bit of discussion I can give is really once you're experiencing some of these mental health problems or reproductive health problems, it's important to open up. I am sorry to the precarious speaker who said that doctors or nurses really did not treat her well. I apologize for that on their behalf. But I think we also have a good crop of health workers, doctors, who can sit with you, try to understand your situation, and try to give some treatment, so that you can go through your reproductive health intentions without necessarily being very stressed. I want to point out the point of other supporting issues. For example, nutrition. Sometimes when you are very stressed, you are likely to be depressed and you're not going to eat enough. When you don't eat enough, you don't build enough iron, and therefore you end up being anemic, you end up not having enough blood that runs your reproductive health function. So all these things somebody needs to go through with you so that your mental health helps to make you sure that your reproductive health function is going well. The other things that we need to look at is the issue of cancers, especially cancer of the breast, cancer of the cervix. Many young girls are susceptible to those, and it's important that you always self-examine your breasts when you're showering and so on, to make sure that if there's anything swelling, maybe a difference in shape, you get it checked. Because if you don't, it may be discovered when it's too late. So again, to bring to your attention that this is also something that you need to be focused on. I'll end it here. It's just to stimulate thinking, and then I'll answer specific questions. Thank you for listening to me.
Yeah. For me, I think it's a privilege that I'm talking after when the doctor has digested the scientific direction, but also giving us a little bit of reality. And also it's an honor to talk before the man of God talks, to bring in the aspects of our society, our moral aspects, and also what is more important in terms of our growth, because we move in the direction where God is always amid us, in that direction where we are going. So for me, it's a great honor. But also very happy that to every student that is still here with us, I might say 10 years from now, you're going to be the leaders of this country. And I think you should clap for yourself. And also I'll add on what Dr. said, that I thank Tukule Foundation for such a great initiative. Especially some of us, way back in university, we never had some of these great opportunities for people to bring us together and have important people like us talk to us at that time. Now, they've given me a very quite challenging, but also a very interesting topic for me to talk about. And I'm going to reflect a lot. What I'm going to talk about is going to reflect so much on the reality and also the life experience that I've really gone through as a young person. I started working on issues concerning issues on HIV and AIDS, not because I went to school to learn about them, but it was the society and my family and how I grew up. So I grew up in the same situation. And I think the time I was growing up, my parents were facing a lot of hard time in terms of dealing with themselves. When it comes to stigma and discrimination at that time, it was very bad. And they had a lot of mental health challenges. And you find that some of these challenges, there was no clinic that was addressing them. And COVID-19 kind of brought them back. We had a lot of time dealing with COVID-19, but not dealing with issues that people were going through. And that's why we had a lot of statements that were ongoing, and also forgive our leaders, because so they were overwhelmed by what was happening. Trying to find the virus, trying to control it, to find vaccines, name it. All the doctors, hospitals were all busy treating us. But we had less units that were treating our minds. We had less units that were understanding our growth in our society and how we are supposed to live. And that's why we had a lot of an influx, a big pandemic that hit our country. And that was teenage pregnancy. What does that really teach us? That our school has been a hub of our mental, has been a hub of counseling, has been a hub that is able to support our mental well-being to grow. In a society where you have friends, you have teachers, they're disciplining us, you have a matron, you have a warden that is looking out whether you're clean or not. That's how we've been living. And now COVID says go back home. And you're going back home to your parents who's looking for money, who has no time for you. And also forgive them, because that's the country that we are in at the moment. That's the environment that we are in at the moment. That even the countries that we think are well developed, because I was looked up in the US for 4 months, they had even worse challenges than we are having here. And also you know that some of our leaders said, you know what, if teenage pregnancy is the problem, let's first concentrate on these other problems. But that was the biggest, and we right now we have so many young girls that are not able to go back to school because they are mothers due to COVID-19. But before, there were other pandemics that brought a lot of mental health challenges that we are facing. So why am I really passionate around issues concerning sexual reproductive health and rights for the young people? In my growth, I understood that the commander of our lives, your bodies, is our sexuality well-being. And I remember in my first year here at Makerere University, community psychology, our first course unit was sexuality, human sexuality. And part of the elements they're teaching us is how you enhance your relationship. And in enhancing of relationship, even they go deeper to talk about sex styles that might be good in your own relationship. I studied it in Makerere University here. Non-pornography or websites. Here. But what does that really call for? That they're telling your commander of your own bodies what doctor has broken down in terms of our body changes. They change every day. I've worked in schools through our programs. Even before I joined community psychology, I was on NBS TV as a youth presenter, working in schools. But the challenges we faced at senior 2, all of you remember, girls dealing with crush. You have a crush on a teacher, but it's a mental health problem. Big one. You're not going to study very well. Am I right? Boys, you're talking about masturbation. Our Reverend is going to talk about it. In senior 2, most of our pockets had holes. And what do we used to do in class? Masturbating because a student teacher is looking so beautiful. Mental health challenges that we are going through in school. But do we have mechanisms that are addressing some of those challenges? And remember, those challenges grow up to our adulthood. All of us, me, I'm here, I'm not going to be scientific, or I'm not going to cross this side. But I'm just going to talk about how we have grown up. All of us in this room, we have grown up and we had chakula kazi, chakula sajja in your societies. Yeah? And they have grown up right now, your colleagues, you see them on how they have turned out to be. But it started way back. But now, if it started way back, did we have systems that are addressing our well-being, our growth, and how we should manage our own sexuality while growing up? So now it brings me to the question that was posed to me on something that I should really talk about. If it comes to youth rights, participation is very important. How are you participating in creating your own policies that are going to govern you? We go to school, we find school rules and regulations. Right now, we are still talking to our school administrators to involve students in designing the school rules and regulations because things have changed. You're going to tell you how to dress, how you should be putting on, how you should walk, how you should relate with. All those are in the school rules and regulations, okay? But isn't that affecting your well-being and your growth as a young person? Another right that we should really look at is decision-making. We need proper decision-making spaces. Spaces that can create a proper environment for us to address issues on sexuality. I don't want to talk today and tomorrow I'm arrested because I talked about masturbation. But I want to talk about masturbation, talk about the dangers and the advantages in a safer space, whereby everyone can take the message home without even being attacked by the reverend or the doctor. Because in my senior 2, I was understanding it by an action. Not because I've watched, but because of my mind, how it was growing, and the doctor has explained it properly very well. But what does it really bring us to? Another thing I would love to talk about, we need to control our lives. In secondary school, all of us understand that we're in a space that is controlled by our teachers. When we go back home, we're in a space that is controlled by our parents. But as we are growing up, we are living in an unadventurous life. Adventurous life that all of us, me and you and my daughters at home, have to be equipped with information to be able to control their lives. And once they're doing that, they're able to make the decisions that can save them from the challenges they're going to face. And the challenges are many. Challenges of HIV are still growing. Right now, we might not talk about it, but that's the hugest pandemic that is going to stay with us for the rest of our lives. Ebola can come, COVID can come, but HIV is there. And how are we all getting HIV right now? It's through our behaviors. Sorry to those that were born with it, but our parents made the choice to do that through their behaviors. So are you going to be the same person through your behaviors to contract HIV because you cannot control yourself or you cannot control your life? But to do that, we need information. We need the safer space for us to be able to control our lives and also live an aspiration of the future that we want to see tomorrow. To control your life. Control. It comes from your sexuality well-being. Your sexuality is your commander. All of us woke up today, no one is naked in this room. Are we? We are dressed. Girls went in the mirror, they looked at themselves, even they are going back to the washrooms to see whether they are okay. That's your sexuality is commanding you to do that. Do we understand each other? The same command is going to command you to either put on a condom or not. Put on a condom. The same sexuality is going to have that desire that is going to make you go do drugs or not do drugs. Right now you're in control of your lives because you're at campus. No one knows what you're going to do today or tomorrow, but you're in control of your own lives. So when it comes to why, they posed a very unique question that we talk about contraception. Good enough the doctor is here. Me, my job is to talk to you and refer you to him. That's my job. And that's what we do. Tell you how to live your life, how to make the informed choices that are going to be able to make you succeed in school, get a good job, get a family when you're ready to get a family. Many of us have got families when we're not prepared. What does that bring? It brings issues of the dysfunctionality of your own individuality as a person who's growing up. Because you're not responsible to be a father or a mother. Sorry to say, doctor, nowadays we have people at 30, 40, they're not even responsible to be fathers or mothers. It's also a mental health problem. It's not only for young people. But remember, it has started way back at 5 years, 10 years, because some of those issues were never addressed. And now they're being parents at their age, but they're not being given parents at their age. I mean, many of us have seen them. Honorable, you might have seen them. 40 years and you're like, is this Michael? Is this guy older than me or I'm older than him? You've seen them. This is reality. It happens. You find your friend or your father is also busy playing video games from morning to evening. And also that is a father. It's a mental health challenge. But it all starts with your sexuality well-being. You find a 20-year-old person with a 19 or maybe how old, they are parents and they're responsible parents. It's a challenge that we're having, and it all comes from our own sexuality well-being. We are looking at unwanted and intended pregnancies are the key causes of stress and mental health failures. And that's what I was talking about. Unplanned responsibility. Many young people are becoming parents. And I know that even here we have parents. Some of you have planned, some of it happened. So when it happened and you're not ready for it, what do? You have your answers. I'm not going to answer, but you have the answers. And we have tried as much. And this is not Humphrey, not Dr. Kagurisi, not our man of God. The government has created all these structures. Whatever drugs that are brought in the country or family planning measures they are bringing in the country are approved by the government because they understand the challenges we go through as young people. So why do you have to get pregnant when you're not ready to get pregnant? If you're not ready, then abstain. Abstain from sex until marriage. If your mental well-being can manage that, but if your mental well-being cannot manage that, use a condom. And I'm being honest with you. But using a condom is the 99%, for me I'll look at it as 99% to protect you from HIV, at the same time, getting pregnant. And if you cannot use a condom, because some of you might be in a relationship and become comfortable, because your mental well-being is telling you and you have developed confidence within one another. Don't so reverend. We have developed confidence within one another. Then you decide, to go all in. In Uganda, you know what we use. Then then seek for emergency contraceptives that can help you to get pregnant if you're not ready. And let's have communication within our relationship, negotiation skills, and all that. So for me, that's what I'm really not going to allow for us to be having unplanned responsibilities when you're not ready and when you have a future that you're really chasing for. Because that's what happened during COVID, and we all witnessed it with our own eyes. So lastly, control over sexual health and pregnancy gives one control over their own lives. It gives autonomy and self-determination as a key factor to our good well-being. That's a fact. It's a fact. Even if you read the Bible, it's the fact. Even if you go to doctor here, he will tell you that's the fact. So allow me to stop here, and thank you so much for this platform.
Well, good evening, everybody. It is a privilege, like I said, first of all, to come to Makerere University. I've told you, me, I'm a Chambogo, which is a village, UCU, which is a village, and some other universities abroad where I've been for study. Reverend Nathan Mugalu, those are my names. I am a counseling psychologist by profession. I am ED at Family Salvation Foundation, Uganda. I am a father. I am a husband. And I am your national male champion on sexual reproductive health, family planning, but also your national male champion on the empowerment of boys, mentorship of boys, but also involvement of men in all our issues. Well, I come from a family of two, where both of us then were boys, but now we are men. And also children, I have 4. 2 are boys, 2 are girls. I got these girls through divine intervention because due to genetic issues, I was very sure that I would get only boys. And I had programmed myself for only 4 boys. But due to the prayers of my wife, here we are, 2 girls, 2 boys, well balanced. I am very passionate about girls and women, but also a champion on boys. And a part of my job is to make sure that boys are well mentored and well parented, but also making sure that men are well involved and actually responsible for their homes and families. I'm excited that we have so many boys and men in this room, but also women and girls. Can we talk about boys and mental health without talking about broken families, where most of us come from? Most of us, the boys and the men, come from families that are dysfunctional. We are being raised by single parents. We lost our parents and we were not given an opportunity to heal. And as boys, you have grown up in circumstances where you've not been able to be allowed to express emotions and feelings. These are issues of boys. Can we forget boys that have grown up without fathers? Maybe your father neglected you, maybe your father left you there, maybe your father has not accepted you in his family. Mental health with boys struggling with relationships. You're trying this girl, the other. Maybe sometimes you'd like to get into this girl, but you don't have the resources to do so. Mental health and disappointments in relationships, in work, and expectations. Mental health with beauty. I don't know, have you ever been involved in a situation whereby somebody has ridiculed you for being dark, for being maybe short, maybe for being tall, maybe for being skinny or big or fat or anything? That's beauty. Our physical beauty and the perception of who we are physically has a bearing on our mental health. Then the other issue is violence. Growing up in violent homes where your mother is beaten and violated in your sight, where you have watched maybe your father, maybe you have watched people that raised you up subjecting your mother to violence, but also even you yourself being subjected to violence. The other issue is health, mental health in boys and men with health, maybe with a disability or with anything. Education, academic stresses, academic stressors. I don't know if somebody has ever told you that on omwana musiru, maybe you're trying out. It could even be a man or a boy in the university here in Makerere, and you have about 3 retakes, you have a test, you have an exam, you have a presentation, you have these, and that cannot allow you to have good mental health. The other issue is survival, struggling to survive. You're in a hostel, you have no upkeep, you're in a hostel, you have no money for your time, for data, for good clothes, for good food and all these things. Then we cannot forget sexual reproductive health and rights. Many of us are still struggling with our SRHR, sexual reproductive health. This one has been discussed. Death, bereavement, grief. We have lost our parents, we have lost our dear ones, we have lost our siblings, and we have not healed until now. And this has led us into what we call PTSD, post-traumatic stress disorder, whereby some of, when we talk about PTSD amongst men and boys, in simple terms, these are wounds on our hearts and on our brains. Post-traumatic stress disorders. These are wounds, these are bruises on our minds, on our brains, and on our hearts. Where has this led boys and men into? Number one, it has led them into alcohol and drugs. And taking serious drugs like Poyet, Smanya vinegar, all these kind of drugs. Even here in the university, there are so many. I mean, you try to hide yourself, to go and find refuge in drugs and alcohol, which leads you into more challenges. The other issue is isolation and self-pity. Withdraw completely, hiding, and what happens in the hiding, all of us know it. Then the other issue is sports betting. Me, I used to think that sports betting is a sport, but sports betting is a coping mechanism to very poor mental health states. Somebody gets buried into sports betting, but also eating disorders, due to mental health challenges, due to stress, depression, fears, anxieties, uncertainties. Boys and men run into eating disorders. I don't know if it also applies here in Makerere because you people are high there, but for us in Chambogo there, when you see a young man having a mountain of food, it's most probably an eating disorder. You get? I've been here sharing with Mama when you gave us lunch. Maybe Rona thought that all of us are doing figures. I told Mama that for us we gave up long time on figures. For us we eat full board. But now eating disorders are as a result of mental health. What has this led us to? Body alterations. Body alterations. Mental health has led us to body alterations. Maybe somebody told you you're too dark. What happens? Skin bleaching. Have you seen young people in universities bleaching? Skin bleaching for what in a university? Who are you impressing? You get that? Skin bleaching. How do you call these things? Earrings, piercing of 10 holes in the ears, alterations of body and physique as a result of mental health, maybe due to physical, all these things. Then it has led us into because of mental health, we have resorted to poor relationships. Have you ever been disappointed, boys and men in the room, have you ever been disappointed by a girl? Then you said, okay, Kambalageko, right? So you go on hitting this one down, the other down, the other down. Have you ever done that thing? It's what happens. You get disappointed by a girl, then you say, okay, now, it's revenge time. I am going to get a book. Joan is down, Joan. Mercy is down, Mercy. Maybe Lydia is down, Lydia. Joy is down. So you have a list of about 40 people paying for one sin. Getting into that due to mental health. The other issue is addictions. Addiction, so many things. And one of the greatest forms of addiction in the university with boys and girls is the addiction to pornography. And sometimes we think that pornography is only electronic. No, pornography can even be in such a genetic environment. Haven't you seen boys getting, Humphrey, you know some English, or kuloba? What is kuloba in English? Staring at women, whoever woman you think about, you make a psychophotographic imagination when she's down.
It's called bamboozling.
It's called what?
Bamboozling.
Bamboozling, eh? You bamboozle everybody. You look at a woman, you undress. You look at a girl, you undress. You get that? Addiction to pornography. But also pornography in our phones, you get? Pornography to these, are they called, you know I'm a clergy, but I also work with the young people. These X what? Videos, eh?
Yeah, the porn sites.
Porn sites. Getting addicted to porn sites. As a result, what happens? Masturbation. Masturbation. Somebody masturbates in the lecture room. They masturbate in the toilet. They masturbate at the church. They masturbate in a shrine. They masturbate in a taxi. They masturbate everywhere. That is sickness. Then pornography. You cannot maintain a relationship. You only look at women for sex. Sexualization of women's bodies. Sexualization of girls, where as a boy, as a man, whoever you look to is a sex object. You want to have sex with them. You reach a point where you cannot have friends of the opposite sex. Whoever comes near you, the area goes up and you want to hit, right? Whoever girl comes around you, the area goes up and you want to hit. So, but again, this also leads us into sexual dysfunctions. I'm excited that my brother who gave a testimony about masturbation, he told us that unfortunately he didn't go into sexual dysfunctions. And I asked my colleagues, our brother is not married. How has he confirmed that he has sexual dysfunctions? So due to mental health, some boys and men have run into suicide, and it is on record. Most suicide cases are happening in boys and men. You get? Go to rehabilitation centers, boys and men. Go to the prison, boys and men. Go to bars, boys and men. Go to sports betting centers, boys and what? Men. Go to drug rackets where they sell drugs. Even in Makere here, I know where the racket is. Go to racket, boys and men. Now, the question is, some of our brothers have died due to mental health challenges as boys and men. Some of us have got mental health challenges from our parents, from our fathers, who have demonstrated very poor examples of who a father should be and all these things. What are we going to do as men and boys? Remember, broken boys and men form broken homes and families. Broken men, much as we are still fighting about gender equality, my brother here, Humphrey, we are ever campaigning against gender equality, gender justice, but we should heed to the fact that Africa and Uganda in particular, we are still a patriarchal society. We are still a number of years away from patriarchy. Now, broken men, broken boys, wounded men can only breed wounded homes, wounded children, and the vicious cycle of woundedness continues until people get buried and finished. As men and boys, it is okay not to be okay, and we are going into a phase where we are going to acknowledge that I have a challenge here, I am struggling. Much as I am a boy, I am strong, I am a wannabe, I have a big board, I have a beard, I am on top of the world, but within me there is a younger boy who is hurt, who needs help, who is vulnerable, and should be attended to. That's number one. Number two, as men and boys, acknowledging that we need support and knowing where to get support. Counselors, we are here. Your male champions, we are here. You get that? Look at the panel. All of us are young people. We have one of our male champions in psychology. Mr. Adrian Kakinda is here. Adrian, you can stand up. Yes. Please, you can reach up to him. You may say that maybe Reverend is old, maybe Humphrey is getting old, maybe Doctor is old. we no longer understand these things. Now we have young people that are very passionate about psychology. Please run to them for support. The other issue is, it shall pass, surely, as long as day and night comes, it passes. As long as night and day comes, it shall Chija kolachi, chija kugwa. As long as day and night passes, it shall pass. Even as we were there, we were students, we were in university halls, we had nothing to eat, we were very poor, we were very ramshackled, very crooked, very hopeless. But here we are making a difference in our country at a young age. You too can make it. I'm very sure about that. Lastly, there is nothing that cannot be talked about. There is nothing that cannot be. Boys, are you there? And men, where are you? Put up your hands, please, because my concentration is on boys and men. Where are you? There is nothing that cannot be talked about. Everything can be talked about. The Bible is very clear. There is nothing new under the sun. That is has been, and that is shall be. People have gone through all the challenges that we're going through. There is nothing new on the face of the earth. Though to you it is new because it is your first time to go through it, but there is nothing that cannot be talked about. Let's talk. Let's talk. Let's talk. Suicide is not the option. Alcohol is not the option. Sexual misbehavior is not the option. Body alterations is not the option. Getting yourself into addictions is not the option. The solution is we can talk. And surely, as long as we talk, whatever you're going through can be solved. Thank you very much.
Now, my question to the Reverend, when he was talking, boys and men are in different places. So where are the men? Because I've been looking, there are very few men. So girls, you look around, men, abasajja babula. So let's work hard to make sure that boys are also put at the forefront of whatever issues that we're trying to address, because that has been a big challenge in terms of our programming, and also that's what we've been always talking about, that most of the programming that is coming in the country, they're focusing on women and girls, and that has always been a focus, and the boy child has always been left out. So it's a huge challenge that different nations, especially Uganda, that we are facing. However much women and girls want to be in spaces of leadership, that's not where the men are always seen, but also the societal challenges we are going through, men also and boys should be put at the forefront than us flooding prisons, because we don't have food to feed ourselves in prisons. So, thank you.
Yeah, let me also just add a comment. One is that the reproductive health consequences on your mental health and vice versa can have a long-term effect on the rest of your life. So as a university student, try to deal with or not make these reproductive health problems go unaddressed before you leave this stage. They will affect your work life, they will affect your relationships, they will affect your family, and you will end up a miserable old man or lady if you don't deal with it now. So like the Reverend said, open up, have it dealt with. The other issue I wanted to address is the issue of sexual gender-based violence. This is a very silent epidemic that is manifesting as teenage pregnancy, manifesting as sexual transmitted diseases, manifesting as HIV. So it is something that we need to deal with. And if you do not equip yourself with information, with a way to protect yourself, to secure your environment, that young man, that young girl close to you could turn up to be violent, and you end up in an incident that you didn't want to have. So we also must look out for in our environment as a university to make sure that it is free from sexual and gender-based violence.
Thank you very much, our very, very esteemed speakers. I initially wanted us to ask each one question for them to let them leave the stage, but due to the interest of time, And also because I feel like they've exhausted most of what should be addressed in regards to reproductive health and sexual health. Can we kindly rather give our closing remarks and then we give other group of people a chance to also speak? Thank you very much. Dr. Kagurusi, you have the microphone once again.
I think my closing remark is those in this room and those watching us, you still have an opportunity to have a very healthy reproductive life. But to gain that, you have to do that now, so that you clean up. Even if it was in your childhood, even if it's now, we're going through it, please seek help, and we are available. We can support you. Many very good health workers exist out there. Let me, by my profession, let me say that, by the way, we're having COVID around, but also still having Ebola. So as we talk about all these things, Ebola is quite fatal. So do everything in your power not to get these highly infectious diseases. Thank you for inviting me.
Yeah. I won't differ so much from what the doctor said on how we should live our reproductive health life, but I'll say that Reach a Hand is really open to university students. You're welcome to join us. We have a Peer Educators Academy that happens every beginning of the year, and registration starts as soon as November. So you can follow our pages. In case you see the opportunity, please register. Why am I saying this? Is because in this room I see a group of young leaders like me 10 years ago, that were willing to change their society and create ideas and solutions that can address some of the challenges that even our dear Reverend is talking about. So it's a hub whereby you're most welcome to be part of us, so that we can be part of the changing world that we'd love to see. Thank you so much.
Well, first of all, I want to thank the Tukule Foundation for seeing me as, qualifying to come and speak to these great men and women in this room. Mental health is health, and it is a priority to all of us. That's number two. Some of the things that give us mental health challenges can wait. As students, money shall come, a good car shall come, a good wife shall come, good things shall come, even sex shall come. Sex shall do what? Yes, when I was younger, I used to think that sex shall run away from me and I will never find it. I found it now 10 years. But please, if you know my wife, don't tell her. Adrian, please don't communicate to her. I have spent about 2 weeks. She's a very good woman, but no sex. You get that? Now the question is, why are you aborting because of sex that cannot run away from you? Why are you getting into depression due to sex? Why are you becoming a scrap due to something that can wait? And why are you becoming a sex veteran at 20? Yet sex can wait, and it's part of the major issues. Young boys and men, please, don't become a smart wire at a young age. These things can wait and they shall come. Lastly, please don't hesitate to contact us. When you go on your Twitter, you'll put there at Mugalu Nathan. That's my Twitter handle. Facebook, we are there. And we are doing a lot of work as far as mentoring is concerned. I wish you well. I wish you success in your academics. I wish you prosperity as in the university. And I wish you good health such that you complete university when you're in good shape. I wish you the best. Thank you.
Thank you very much for sharing. Does she have a question? Okay. I have a microphone right here.
Sorry, I'm a bit nervous. But I have a question. You talked about, specifically you, doctor, you talked about like when they have like an issue or something, they should get counseling and something like that, right? But I have to ask you, as much as we're talking about mental health, why is it therapy is given as a privilege and not a right by the ministries? Why? Because if you look at it, I have, like you talked about sexual disorders and everything, right? But it starts in our teenage years, as you said. So when we are having these issues, we can't talk to somebody, because if you look at how much therapy costs or any sort of like these things, it's so expensive. It depresses you looking at the prices itself. So how do you want somebody to get help if you're not even improvising mental health in a school like CBT, cognitive behavior therapy, which helps with stress and different ways to deal with like self-harm or different like sexual addictions? I'm sorry, I'm really nervous. But it's something that's been in my head, because I'm from university. I was in Ispat University, and I've seen people go through different kind of things. I have personally been through things. And when you look at therapy itself, it's so expensive. How do you want us to get the help? And when you say group therapies, yes, I agree, they help. But you're not as comfortable to talk to somebody about your disorders so openly. And some people have different personality types. Let's put that in mind and perspective. So how? I'm sorry.
No, you don't have to be sorry. Feel free to open up. I must comment that our health systems and social systems are not as well developed as we want them to be, yet the problem is here now. But the good thing is that we are having conversations like this. We are having different entities that are offering services very cheaply. The first thing is to get the right contact. Then we can even subsidize the therapy that you are going to get. So don't be scared to open up. Open up to somebody, then you get reference to more affordable interventions. But the most important thing, find somebody you can confide in, and then engage the whole spectrum of people who are willing to help.
And to add on what Dr. Kaguris has said, there is actually a number of organizations that right now offering the services for free. We have Mental Health Uganda, we have Strong Minds, so you can always reach out on those contacts.
Maybe her point as well, we have Honorable with us, very young. What she's saying that spaces from primary, secondary should have an environment. Some of these issues can be addressed.
I think in the last few weeks or something, it has actually been implemented to make sure that every school has a psychologist.
Well, the psychologist is there, but there's an information gap. When it comes to sexuality education, how comprehensive is it to address the challenges that young people are going through? So that's a legislative, whereby in Parliament we're talking about issues of sexuality education to be accessed by all, not even embedded within a curriculum, but also in more practical sense. So that's what we also have to advocate for. Thank you.
I think in the recent, mostly one of the reasons actually why we invited Honorable is they're actually raising these issues and they're trying to make sure they're tabled. So I believe with his help and very many other members of parliament that believe that this is something that we have to drive and create awareness about, I believe it's eventually going to be achieved.
So have hope, it's coming.
All right, unfortunately, due to the interest of time, we're going to have to let you go and call the next set of speakers and then hopefully conclude shortly. Thank you very much for your time. Okay, I'll kindly request the other speakers to also kindly come sit down. So as we go through this, because this, I think it makes it much easier and also kind of helps us keep in time in one way or the other. Next speaker, we're going to be talking about substance abuse. We have Mr. Newton Atwine, who is going to be talking about peer pressure. And then we have Katha Mwenda, who's going to be talking about substance abuse. And then we're going to also have a session about coping skills, but due to the interest of time, I would request all these people to come at once. So Newton and Nkatha, kindly come up. And then we have Daniel from One Hope, who's going to be talking about spirituality in mental health. Then we have Elizabeth Okello from Uganda Counseling Association, who will be sharing about it being okay to seek help. Thank you very much. Okello, Elizabeth, thank you. Okay, as Madame Elizabeth is coming up, Newton, you can kindly introduce yourself shortly, and you're then going to proceed and talk about your topic, and then Nkatha will come next. Since it's peer pressure and substance abuse, I believe they're in the same bracket in one way or the other. And then we're going to have Daniel talk about spirituality and mental health, and then Elizabeth talk about, please do seek help, like what she's been talking about. Feel free to seek help. That's why we have Dr. Nekesa and every other psychologist and psychiatrist around. Thank you very much.
Good afternoon. My name is Newton Isaac Atwine, and I'm the founder of Youth for Change. It's found in Cape Town, South Africa. And I'm pleased to be here this evening. I think it's evening already. And I would like to take this opportunity also to thank each and every person that is still here. Thank you for your patience and commitment. I know it's been a long day, but thank you for still being around. So I'm here to talk about peer pressure. Peer pressure is normally termed as a negative thing, but peer pressure has different sides. There's peer pressure, there's peer influence, but it's not necessarily always a negative thing. As I said, that I have a youth organization in Cape Town, and I deal with kids that deal with drugs, that join gangsterism at a very young age. So there's a bit of a challenge when it comes to kids actually opening up or being, you see, when it comes to peer pressure, as I said earlier, it can be a good thing, it can be a bad thing. But you find an 11-year-old who is on drugs and who has a gun. I thank God in Uganda we don't have gangsterism. Yes, we have guys who make a lot of noise and crime, but they don't have access to guns. But you find an 11-year-old who is on drugs and who is having a gun. You see, these gangsters, they target these kids and they train them at a young age. So they make them, you see, in every child, there's a need or desire to feel like they belong somewhere. They want to feel accepted. So they end up doing things that are contrary to even to their own interests, but they want to feel accepted in a certain group of people. So unfortunately, you find there's no one, because in most cases you find they are single parents, they are single parent families, and there are some things that a woman or a mother cannot teach a boy. So you find there's that gap. There's no one who is there to guide them, who is there to teach them. So you find every time they're on the street and they're with other boys, they feel they belong somewhere. So these guys now are vulnerable because someone has an opportunity to teach them something that is wrong, but to them they want to feel accepted, they want to feel like they belong, and they end up adjusting, or they end up surrendering themselves to, they are committing themselves to these behaviors, to these. So for example, if I'm to use an example, these gangsters had like initiation. For you to be part of them, you have to first kill someone. If you want to join a gang group, you have to first kill someone to show that you are ready to join, to show that you're a man now. It doesn't matter whether you're 11, they want to make you feel like you're now a man, you can do it. If you want to be part of us, this is what you have to do. That is the negative part of it. But the positive part, someone might be doing something that is in your age group, but maybe at first you are discouraged, at first you didn't believe that you could do it, but when you see someone else do it, you're also motivated and encouraged to do it. But I pray that if we are to influence someone, you influence the positive part, not necessarily the negative. So you see, for example, these days we have a problem of social media. When you see people in your age group, everyone is holding an iPhone 14, everyone is driving, you are willing to do whatever it takes. You're not considering the outcome. You're not considering the consequences. For you, your aim is on to get what others have, of which if you wait, you can actually get it the right way. As the previous speaker said, don't skip a certain stage, because they say when you rush, you crash. So in most cases, the antidote to peer pressure, the antidote to bad peer influence is prayer. I believe so much in prayer. So, someone asked, what is the point being famous on earth when heaven doesn't know your name? Yeah. Because at the end of the day, whatever you're fighting for, it is going to stay here. That is what we forget. Whatever you can achieve, everything, and the day you feel like you have achieved it, tomorrow you leave it all behind. But where are you going? So if you are to do something, bear tomorrow in mind, because there is always a tomorrow. So in whatever you're to do, don't be easily influenced. If you feel something is wrong, you don't have to do it. Don't compromise, because it will cost you. Someone can introduce you to drugs. Tomorrow they recover, they stop using, but you're already addicted and you become the victim. You find the people that introduced you, tomorrow they're in a better place, but for you, you're still stuck there. So in whatever you're to do, think about your tomorrow and know that you always have the power to make the right decision. Thank you very much.
Good evening. Good evening. I'm very happy to be here. My name is Nkatha Mwenda. I am from Nairobi, Kenya. And I thank Tukule Foundation and Makerere University for the opportunity to speak at the Mental Health Summit. I'm so happy also to be here to talk to you all this evening. I'm excited to speak at universities because the challenges I had with alcohol and cigarettes began in university. I like to use my story as a point of reference, because from this story, maybe one or two of you may be experiencing that kind of, a lot has been spoken about mental health. Most of the time, it's either assumption or how you're feeling. When I was growing up, we lived in a relatively good home. I love my parents, my siblings, and they're very supportive. And I remember wanting to be a pilot. And after high school, my father was very keen to know what I wanted to do, and he took me to flying school. So I went in as a student pilot, and in flying school is where I learned how to smoke and how to drink alcohol. And I like what Newton is saying, is that peer pressure. I didn't see an advertisement. It was a friend who was doing it, and everyone seemed to be doing it. And the ratio of girls to boys, obviously the boys were more. It was many years back. And that simple influence, it looked simple. Drinking alcohol once in a while blew up in university, because when I was just ready to pursue my commercial license, yes, I got my private pilot's license, I can fly a single engine aircraft. When we were I was imagining just about to go do my commercial license, come back to Kenya and join the national airliner. My parents didn't tell us they were going through financial challenges. They told us, my brother was in Australia at that time. They just said, we're going through something small. I was told, go look for a course in university. As we sort ourselves out, we will be able to get you back on track. Many years later, we are still waiting. But what happened is I felt rejected. So I don't know how many people have been forced to come to university today or not pursuing the course that they desired to. But I went to university checking out for a course I would do, only to find that I had qualified by merit to pursue a degree in nutrition at a public university. So what was great news to my family was the worst kind of news to me, because of what I desired or the path I had already started in aviation. So that is where the depression began, in university. So in university, as I pursued my career in nutrition, I would attend classes, but any opportunity to drink at the student center, I ran for it. I coped using alcohol. I tried to stop many times, but I couldn't because I had acquired alcohol dependence at one point. I did graduate, but in that, when I look back at my university years, it was the saddest. We are above 18 here, and I'm very open, even on YouTube. If you just write my name, I have shared my story about how alcohol almost killed me. Is in university, because of being vulnerable. Less girls were drinking at that time. There was a lot of shame, and I obviously got into situations where I was raped or almost violated. I speak about it confidently now, but you can imagine the silence, the shame, having to cope with all that, so I drank more. So when I speak about alcohol and drugs, it has taken me years to open up. It is in March of this year, 2022, after being sober for over 6 years, that, God told me, just talk to people about alcohol and drugs. I did not learn from an advertisement or from the billboards. It was through a friend, So we need to really ask ourselves, even as we live these lives, and this is part of mental health, who is the person who molds you? Who do you believe in? Many of us want to be like other people, but what message are you telling yourself? I walk this life now, trusting in God and being confident in what I do. But in campus or in flying school, I was always ready to listen to other people's opinions. So my first point is, you need to love yourself. You need to be confident about yourself so that when you're surrounded by peers and you have all these options being offered to you, because you already know yourself, you'll be able to make the right decision. Do I have regrets of the past? No. Maybe I had to go through all these challenges to be able to advise students in campuses, like here in Makerere and in Kenya. I do a lot of that in different institutions, in high schools and in tertiary schools, so that we can be able to take charge of our lives. When you're different, doesn't mean you're shady or you're not cool. You'd rather be shady or uncool, but do the right thing so that you don't have regrets in the future, so that you don't have stolen years. I look at my life. The drinking didn't stop until way into my 30s. I had a son who I neglected, obviously, because alcohol was a priority. Till today, he's a teenager now. We've been working our relationship. I use my story to tell you as young people, this is the warning sign. You don't have to go that way that looks exciting, that looks fun. Alcohol or any drug will not give you long-lasting fulfillment. In fact, this year when I was directed into alcohol and drugs awareness, the first thing I keep highlighting is the dangers. You're not told about alcohol, any amount of alcohol being the cause of 200 plus diseases. Did you know that? That you can get cancer, that you can get high blood pressure, that you can get all these non-communicable diseases when you take alcohol. So they will market it as this exciting drink, obviously that will get you high, but they don't tell you about the harm that it causes. My story helps me to speak about the harm caused by alcohol. They don't talk about the dysfunctional families. I like the way the panel before has talked about dysfunction in families. They don't talk about the violence that comes with alcohol use or drug use or substance use. They don't talk about the negative impact it has in society. But guess what? World over, they prefer profits to you being okay as an individual. And back in Kenya, what we are doing, we set up a community-based organization called Graceful Youth Recovery Center. And our main purpose is two. Number one, to lobby, to keep talking about the harm caused by alcohol and be able to get the attention of government to change policy so that all these companies can be forced to put the harm on the labels. Are we together? Because many people say this is harmful for 18 and above. Then they say excessive use of alcohol is not good. But the fact is, any amount of use of alcohol is not is harmful to your health, amongst other things. So we are raising awareness, going to schools, going to communities, just highlighting the dangers, careers that may be stolen, time that may be wasted, that you can be able to avoid anything that you become dependent on. Something else that they don't tell you is alcohol and drugs have dependency properties. They don't tell you that. So you innocently start taking alcohol or any drug, and because it has dependence properties whereby if you take it continuously for a period of time, when you stop, you get withdrawal symptoms. Many people drink or take those substances because they're already addicted, because they're dependent on it. They need to tell us that on the labeling, you know, things like those. That's what we are pushing. Graceful Youth also takes care of the women and children who find themselves in situations of addiction and are commercial sex workers. And there are so many. There are people who are selling themselves at less than $1, $2. I keep asking God, why did he have to let me see all that? Because it has become a burden to me. And that's how the center started. And we already have one lady who, how it works is we see them every week. We go there, we go with different people to encourage them. And as we use the word of God also, it's faith-based. We didn't have a physical center yet. But one of these last weeks, something has just happened last week, is one of the ladies we found out was pregnant. And remember, she's a commercial sex worker, meaning she's exposed to all those things, and she suspected she was 9 months. Obviously, we saw it now that she needed medical attention. And us as an organization, what we do is we look for partners to help us in such situations. And we got someone who took care of the maternity cover, which happened 1 week after we met her. So as we speak, this lady, all the times we have met her, she has always been drunk. She's always been high on something. And when she delivered, it was an emergency, and she was discharged after 3 days. We could not take her back to where we found her. So she's currently in a safe house, ready to transition into our center, where she will be for 6 months. And what we intend to do with her, and the many who will follow suit, is to equip them with a path to recovery, number one. So we are working with professionals in that field to get her off the addiction of all these substances and the drugs she's been using, and also to equip them with socioeconomic skills so that at graduation in the 6th month, they can be able to go out and be productive. And we also ensure reintegration. So we are also involving the family and those people who are known to these women specifically. And why women? Because we want to break the cycle. These are people who are in 2nd or 3rd generation of prostitution because they saw their mothers or their aunties doing it. And so just seeing the children get into this cycle is what is the motivation of having a heart towards this kind of people in society. So in conclusion, I would want to urge you just to be focused. I like the way Miss Irene was really clear that we need a purpose. Maybe I had to go through the pain I went through to be able to be a voice of reason, so that someone doesn't have to use alcohol to a point where they're dependent and they lose so many things in the process. But I thank God for arising and being able to raise up and be able to speak life, to speak hope, because I speak for the 3 million who die every year because of alcohol. Those who die in accidents, those who die from overdoses, those who die because alcohol harms, alcohol kills, drugs and substances kill. Do not allow to be a statistic. If you can make that decision to focus on your studies, focus on your purpose, focus the direction you desire to go. So what we do is offer support, and we are very open to partnerships. And I thank Tukule, for the invitation and just to see the impact that you have in Kenya and even beyond. So thank you so much, each and every one of you, for listening. Thank you.
Hello, friends.
Hello.
Yeah, it's almost we're almost winding up the day. My name is Binzika Daniel Isaiah. I work with One Hope Ministry. It's a ministry that whose vision is God's word every child. Our mission is to affect destiny by providing God's word to all the children and youth around the world, but specifically in Uganda, I would say around Uganda. And I'm really excited to be here. Thank you very much, our hosts, Kutukule, and all the other partners that have been able to invite us. We are glad to be on this journey with you. And everyone else, all protocol observed, we appreciate that we are here. And glad that mental health has been tied, spirituality has been tied into this, because we really cannot handle the other three aspects, the psychological, the physical, and forget the spiritual part of everything else. So it's really a very, very core element. And yeah, I prepared to, talk about a few things here and there, but I'm excited that most of the speakers are actually previously hinted on this area already. And my focus is going to basically share with us what God's heart is in the area all concerning mental health and all. And I'm glad that God really has very good news for everyone who's in this place or someone here that is really struggling and all. So we're in a world where we've given access to so many things around us. We've given access to Facebook. We allow all those things come in every other evening. Maybe when you go back, you get to listen to this news bulletin. We allow that to come in. You're allowed to see that other WhatsApp status and all these different things. I believe it's time for us to also let in God, right? Because we get to let in so many things into our lives, and I believe it's time for us to also let in God, and it's really very, very important. I would love to start from a place of, well, as a ministry, we are passionate about research. So we do research for many of our programs. I'm sure you might have seen some few copies of One Hope Ministry on some of the tables. So early this year in March, we did a research called the Global Youth Culture Research. This research entailed us, finding out from the teenagers. Now, teenagers are going to be seated where you are right now. Those are teenagers in school, and very soon they'll be with you, in these lecture halls, and they'll be coming around to enjoy what you're enjoying already. So these are some of the findings. So that research entailed, we asked questions on religious attitudes, and we asked questions on influences and guiding voices. We asked questions on personal struggles and experiences, and I believe that part actually talks a lot about mental health, and I'll give you some few details on what we got to discover. Because wherever One Hope is, we did what we call the Global Youth Culture, and it entailed countries countrywide. So we also requested to do the same research in Uganda, and it was really, really, some of the findings were really alarming, and it was really interesting to find that on the whole, the sample space we used, because we went to a number of districts, actually every other region was represented: Nebi, Gulu, Agago, Kampala, Makere, Chivulu, Luwero, Wakiso, Masindi, Kabarore, Mbara, Kabale, Jinja, Mbale, Moroto, Buyende, Kalangala, Masaka. So we made sure we cover at least, we picked some feedback from each of these regions, and we realized that 49% of the teenagers told us they go through loneliness. They are lonely. Yeah, that was really, 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 really hurtful. Suicide, concerning suicide, those that have actually attempted committing suicide, of the whole, about 11% have actually attempted to commit suicide. That was really alarming. Depression, at least about 50% of them have actually gone through an element on depression and all. Those that have had suicidal thoughts, someone attempting suicide, that's about 20% of them. And yesterday I was on the street, interestingly, and I talked to a young man who told me that they tried, I think they were taken to prison, and then while there, craftily, they actually tried committing suicide. Unfortunately, it didn't work out. So that young man actually attempted to commit suicide. All that springing from a part of, mental health challenges and all this, high anxiety, about 43% of your brothers and sisters, friends, that are going to be at campus, because we did this with basically secondary schools. They are going to be seated in these halls, but this is what is actually happening in their lives. Someone once said that the state of children in a country speak a lot about the future of that nation. So it's really very key. It's a very, very key issue that we need to really address, and I'm glad that also God is actually is very, very positive about seeing that people get to heal mentally and in all those different ways and all. So, of course, we all know what happened. Corona virus happened, and this caused a lot of, unknowns and questions and all these different things. All that kind of created a gap, That's the same time we had quite a lot of, alterations in families and brokenness and all that. That was really hurtful. Talking about the Bible, it may not explicitly mention the word mental health, but it actually handles some of these different topics and all. Even in the Bible, you see lots of, situations where a person that maybe was going through some mental challenges, that was tagged as demonic, or that was tagged as, divine punishment, of sorts. Why? Because somehow, the same as today, there's a stigma of sorts of if someone were to mention something about what they are going through, people will either isolate them and all that, and we're going to see some examples from the Bible. I mean, look at Job. Job struggled immensely. He struggled, for those that are Bible readers. That was really, really, really quite a lot. This is what it says. Job got up and tore his robe and shaved his head. Then he fell to the ground in worship and said, "Naked I come, and from my mother's womb, naked I will depart." That was a state of mental health. So some of these guys actually in the Bible did go through some of the things that we're experiencing. I'm glad that one of the speakers actually said there's nothing new under the sun. Looking at another character, David, in Psalm 142 says, "I cry aloud to the Lord. I lift up my voice to the Lord for mercy." That was a cry of help, right? That was a cry of help of a man who is saying. So it continues and says, "I pour out before him my complaint." Many of us, of course, have lots of things that go on, and you always want to cry out to someone. And you know what? I want to encourage you that you can actually cry out to God. God can still have access to your life and can still be the answer, And I'm glad that we are not leaving the other elements out. Work on the physical, work on the psychological, and the spiritual is also very, very key. Elijah, I think I will end with Elijah, whose mental health suffered during the conflict with the Queen Jezebel. Elijah fled the country to the place by himself where he wished to die. God dealt with his physical needs. He gave him something to eat, but he also gave feeding him and giving him time to sleep. Elijah slept after that situation. So that means there are interventions. God requires us to have a healthy mental state, a healthy mental being. There are some of us that don't sleep. This is a time where actually the Lord allowed Elijah to sleep after giving him something to eat, and eventually he actually was over all these different things. So God is interested in you having a wonderful mental being at the end of the day. Let me end with Jonah. An example of someone whose mental health was tied to bad choices, He disobeyed God. That was a terrible choice, Jonah wished for death after God spared Nineveh. He desired to quit, and also somehow fell into a state of, how can you not destroy these people and all? That was a clear example of a mental challenge that he was dealing with at that point. So the things you're going through, my friends, are not very new. Many people in the Bible have also gone through the same, and there's actually hope for the future. And also, God is near to the brokenhearted and saves to ensure that at the end of the day, he feels that emptiness. So God would love to walk with you this journey. As you walk the physical journey, as you walk the psychological journey, God would love to be a part of this journey. And what do I take out of all this, you know? The big takeaway from the lessons from the Bible is the fact that at the end of the day, everything is actually possible. You may be in a challenge, you may be between a rock and hard place. God is the answer. Alongside all these different things that you're actually going through, you too can actually be comforted by him. And this is what it says still, since we are handling the spiritual bit of it and how God, because we're handling God's heart, what does he desire for your mental state? And this is what Matthew 11:24 says. Come to me, all you who are weary and burdened, and I will give you rest. So my friends, God will want you to have rest in him. Can we rest in Christ as we give access to all these different things that, you give access to Facebook, you give access to social media, you give access to all these things. I think it's high time that we give access to God to also deal with some of these issues alongside the different people as they help and come alongside us. It all goes back to, are we ready to walk this journey? Because our professionals are ready, and we've heard from them, are ready to help us, but are we ready to actually continue this journey? And we can't do this alone. We actually need God in the entire sequence. So let's balance the physical, let's balance the spiritual, and let's balance any of those different things. So someone, I think once, someone said here that, it's actually expensive to, mental health challenges are expensive to deal with and all. But I believe one of the surest ways that you can access even in the comfort of your home is God, right? Is God, and is not expensive. So long as you surrender to him, so long as you actually give him your all, he's ready to deal with your depression, he's ready to deal with the loneliness, he's ready to deal with any other issues, anxiety, and all these different things. So I believe with all my heart that God's heart in concerning this subject is that he wants you to get well. Thank you very much.
Wow, thank you so much, our speakers, and with all protocol observed, due respect to our keynote speaker, thank you so much for sharing with us your wisdom, and to everyone who is seated here. Thank you for braving this day. You must be exhausted, but I am glad that you've been able to sit through and be able to listen. Every moment that we have spent here, I can promise you, is very valuable. My name is Elizabeth Okello, currently serving as the president of the Uganda Counseling Association. I work with Mild May Uganda as well. I share sentiments with some of our speakers, including our keynote speaker who mentioned investment in families, one very important legacy. I am married. December this year, I think we'll be celebrating 17 years. I do have 3 children, and for me, legacy for family is very important. So I do share that sentiment, and I am very glad, and that should be an inspiration to the young girls out here, the young women here, to say that it is worth investing in. If everything, your books and everything will not, it is your investment in your legacy, which is very important. Why am I here? Here, just to let us know it's okay to seek help. It's okay to seek help. I'm a counseling psychologist by profession. I celebrate one of our mentors here, Dr. Nekesa. Thank you. It's good to see you. We do have other members from the Uganda Counseling Association present. If you're a member of the Counseling Association, can I see? We do have them here, and thank you. I will just say, maybe just a brief about the association. We've been in existence since 2002. This year we're celebrating 20 years. 20 years, and each one of you is welcome. End of November, that is Friday, the last Friday of November. Each one of you is welcome. It is even a student, anyone who feels worth celebrating this, please come. If you want the details, I'm sure we'll be able to have any of us be able to give you the details, but I would just like to extend that invitation. Uganda Counseling Association exists to see that professional counseling is embraced. I'm sure that with all this that you have listened to, the challenges, the substance abuse, the drugs, the alcohol, we've talked about sexual reproductive health, we have talked about, you have listened to all this. It is okay to seek help. It is okay to seek help. My sister there who was talking about it being a right and privilege, I think it is, I just wanted to mention that when we hear those voices come out, we are more energized because we are at the front of the battle, trying to ensure that everyone is able to receive the professional help that is needed. It is work in progress. I must say that today when we see the headlines go out there and we say that every school should have a counselor, when we see the ministry saying that yes, we need the counselors, our emotions could be like in both sides. We are like, are we ready for this? But also we are saying, yes, this is actually something that we want to see. I'll just comment that we are in liaison with the Ministry of Education. We are working closely with them to ensure that some of these things are put in place. Prior work has been done, but like you see, we need to do a lot more advocacy to strengthen that this shouting of ours to ensure that this is actually effected. With the Ministry of Health, I must say that this year we were able to submit a scheme of service for counselors and psychologists to the Public Service Commission, and we are hoping that if we get our minister consent, we will be able to have a counselor in our health centers, right from Health Center 3 up to the regional referrals. You go there, but I don't know how many of you actually get the service of a counselor in some of those places. And why? It's just because we do have a system that needs to be followed, and we need to follow that. I'm glad that our Honorable Member of Parliament is here, and we have been in engagement with the Parliament as well. And the Forum for Mental Health is much aware about the agenda of the Uganda Counseling Association, not for the association, but for each one of us, Why do we need to seek help? Irene was here. I was listening to her on another forum this morning, and I wish she was here to hear. One thing that she mentioned was the why is more important than the what, the how, the when. And I picked that this morning at about 6:30 when I was listening to her deliver a presentation on another forum. And the why, if you forget everything, I think the why is very important. Why do we need to seek help? Each one of us has gone through, I'm going to just mention about 4. Either you are in a position where you're struggling to make a decision. Tell me that you have never been in that position where you want to make a decision. To marry someone, to take a course, to change your career. You know, we have been in a position where we need to make a decision. Each one of us has been, we could have been in a position also where we want to change a behavior. We've talked about addictions here. You want to change a behavior. There are habits that you're struggling with and you're stuck. You're seemingly stuck. You had a sister here say, I wanted to get out of it, but I didn't know how. So you could be in a position where you are stuck. If it is not that, then you are in a position where you're struggling to find meaning in life. Everything around you has lost meaning, and you're struggling to find meaning in life. Who am I? What am I doing here? Why do I exist? Where am I going? We have those questions that we might ask ourselves, or if not, we are going through a difficult time. Difficult time ranging from loss, it could be anything. And those are different reasons why we seek help. Listening from a lot of our speakers here, we have been pointed out to different places where we can go. Each one of them here is representative of a place where you can be able to receive help. If you need help with addiction, with substance abuse, if you're struggling with sexual addictions, if you're struggling, each one of them has provided an avenue. At the Uganda Counseling Association, we do represent a cross-section of different professionals, those who are trained We have psychotherapists, we have the counselors. We also represent private practitioners. We do represent institutions of higher learning. I know Henry Nsubuga is not here, but I would like to say Makerere University is one of those great institutions that I would confidently say is a member of the association. We do have Makerere University Business School, Kisubi Kisubi University. I could go on and name, but we also do have institutions. And our role as the association is to ensure that professionalism is expressed in what they are doing. So we do represent all those stakes, and seeking help can be from any of those avenues. But I would just want to ensure that I would want to say that we do have so many proclaimed practitioners out there who will say, yes, I am a counselor, but we know they're doing a disservice. But why we are here on this platform is to say it's important that you seek out for someone who is professionally trained. Who needs help? Each one of us, okay, for now, just get out your smartphone. I know if I know how to use one, then the younger ones than me know even much better. Who needs help? We know how to do selfies. We know how to take selfies, right? Yeah, can you turn on that selfie bit, and can you see, what do you see there? Turn on your selfie, the selfie one, not the other one where you're going to take my picture, but the selfie one. Can you turn on your selfie? Yes, can you look there? What do you see, or who do you see in there? Yes? You can see yourself. Now that is the person who needs help. I like the fact that someone pointed out and said, even those who are seated on the podium, we are not excluded. I know I would quote Mr. Gaston Biamugesha would say that in life you'd either find yourself in a hospital or he said in a mental health facility. It is not, I can't exclude myself. I cannot get shocked if tomorrow I woke up and I am in the Butabika National Regional Referral Hospital. Each one of us. Why? Because I need help. We are going through moments and each one of us needs help. I'll just go to the second last thing that I would want to mention is that our keynote speaker mentioned something very vital about what therapy does to the brain. And she mentioned something about the processes that go on in our brain. And I must say that some of us may think, but I just go and someone just talks. But there's a process that talking does. It supports a rewiring, and I will use a rewiring in our brain, okay? A rewiring, because when we go through moments, I think Reverend Nathan was talking about PTSD. When we go through moments, it causes, it disorganizes, or just as plain as it would be, disorganizes the wires in the brain, okay? And then the rewiring process needs to take place. I might say, I know before I even went to train as a counselor, I kept thinking, I think I can do it. Even while I was training, I said, I think I can help myself, even when I'm going through that moment. But I can tell you that if you have been in the heat of it, you will know that you cannot get yourself out of it. You actually literally get stuck. Even if you know all the theories of counseling and everything, you will get stuck. And you need somebody to help you. And that talk helps you to get a different perspective, to gain perspective, one, of what is happening. Can you see what is happening? Are you able, just like you looked into your selfie, do you see what is happening? Do you actually see what you look like? Do you see how this situation has torn you apart? And you know, gaining insight is the very first step for you to actually be able to start your journey to healing. Gaining insight. But most times we find we get into denial and we think we can tussle it out. I will go cry on my pillow and it will be okay. Gaining insight is very key. And then now you move on to the next step. Now that I know that I am struggling with this effect, something that I went through when I was a child, what do I need to do? then that's where you're able to now move on to say, I need someone to work through this with me. Can we talk? Can you ask me some of the key questions that I need so that I can think through this? Can you support me to build my inner strength? We had Angela talk about the fact that I am not my mental illness. It is really more about that inner strength that you harness from within you. I don't know how best to simplify it, but there is an inner strength that each one of us has. I have personally been in a situation where I thought I was going to die. And I kind of know what it feels like to harness your inner strength to say, I am not going to die, and I am going to tussle this out. I have been in that battle. And I believe strongly that there's an inner strength that each one of us has to fight through an addiction, to fight through grief. You've grieved for so long. Each one of us has that strength. So therapy or professional help is what helps you to dig through, pick up that potential and use it. Use it. And use it. Eventually, you build a skill over time that today it seems your worst hit. Tomorrow, even a worse one happens. But because you have built some inner strength that you're able to kind of sail through, and I will not say easily, but it will not stretch you as much as it would have if you hadn't harnessed that inner strength. And that's the term that we call resilience, where yes, you will break, but you will kind of get yourself back together. Not alone. Each one of us needs someone. So the emphasis of saying, please find someone who you can confide in. Let us strengthen our family unions. We die with issues within our families. Let us strengthen that. Be mindful. Put everything aside, our family wars, our differences. Within the family, if someone within the family does not realize that you're struggling, it will be difficult for the neighbor or any other person in the community to realize. So please let us do that. Let us break the stigma. Let's not close our loved ones in the home and say, no, how will people get to know that this person is struggling? Let us come out, be open, let's talk about it. My colleague here has said, go to God. He knows it all. I mean, we cannot exhaust it. Just to add, and as I wind up, I talked about the institutions. I talked about places of worship. We do have professional counselors in some of our places of worship. I think Rona mentioned that we do have some toll-free lines where you can be able to access a therapist, to be able to engage with you. And then we also have we are glad that some of our health facilities have embraced the aspect of hiring a professional counselor in those facilities. Some of our insurance companies even pay for that. So those are some of the things that we can advocate for. Each one of you has a voice. Don't think that, who am I to actually say something and the president or the first lady gets to hear what I have to say. Each one of you has a voice, and we can start from where we are. We can cause impact, and we can be able to move this agenda. And let's not just think about only us and how we can benefit, but I think let's think about the generations. We can start, and we can start now. Let's not wait for tomorrow. And it is okay to seek help. Thank you so much. Thank you to the organizers and to each one of you for coming. Thank you. Over to you, the moderator.
Thank you very much. I think we've all learned one or two things from the speakers. Kindly let us give a chance to Mr. Honorable to take his leave, because he's such a decent gentleman. He did not want to leave without saying goodbye. So, Mr. Honorable, you're free to leave. We have one last speaker. However, I'll let you guys leave. Thank you very much for your time.
Due to the interest of time, once again, Mr. Patrick Agurusi did share something with me earlier. For those of you who had questions for Patrick Agurusi or the team of the reproductive health, or the guys who have just left, kindly send through your questions, and then we can always answer them and share them on our social media handles and on our website. So feel free to send through the questions, please. Thank you very much. Our last speaker, Madame Hajat Mastula, kindly come. Thank you very much. Madame Hajat Mastula is going to be sharing with us about coping skills of mental health, because we've shared a lot about mental health, the challenges, but we had not expounded on the coping skills. So that is what Hajat Mastula is here to share with us. Thank you very much for your time.
All protocol observed, I am so privileged to be here this evening. My name is Namgany Mastula. I am a counseling psychologist, and I'm also a PhD student, but I've taught many students in here from Makerere, from Chambogo University, from many universities in Uganda. I am going to talk about coping. A lot has been said since morning about the many challenges that we as individuals face. And let me tell you one thing. When I was preparing my presentation, I discovered that mental illness is a silent killer. You can die without people knowing that you're facing a challenge. But I am so happy to be given this topic. Let me recognize the presence of our president, Elizabeth Akulo, the university counselor, Mr. Nsubuga, and my mentor, one of my best lecturers, Dr. Nekesa Jacinta. She taught us individual differences and personality, and I've used some of her notes to prepare. I am currently doing my PhD. I'm almost about to cross to the doctor line, but I'm going to talk about coping. What is coping? Different individuals do talk about coping in different ways. I read a book by Truebridge, Sarah. She says coping refers to conscious strategies used to reduce unpleasant emotions. We don't have control over what happens to us. Many things do happen. You've heard from the president of the Uganda Counseling Association. You are a student at Makerere University, you find yourself getting 2 retakes, yet you've been putting in a lot. Or your parents can pass on, or you can lose a dear one, or relationship problems. You're married, your children don't have school fees. Many things do traumatize us. Many things do make us mentally ill. But how do we cope? The number one point, as cited by Martin Seligman, please don't fear to open up. I know this contradicts with our cultural values and norms, because I, for one, when I was being raised by my mother, she used to tell me, in Africa, we have to conceal. If you're going through a challenge, you shouldn't share with someone. But I realized that even as my mother was also trying to conceal, she was getting mentally ill every now and then. After joining my master's class at Makerere University, after becoming a mental health helper, I started with my family. It was a prerequisite. You deal with your family members. I went back home, I talked to Hajat, we started talking about it. My dad had extramarital affairs. We were experiencing polygamous family because we are Muslims and it's allowed in Islam. But as human beings, it hits you and sometimes you fail to cope with it. So I went back, we talked about it, and she was like, every family needs a counselor. Everyone needs a counselor. In spite of my expertise, I have many counselors. Whenever I meet these counselors, I'm like, do you know what I'm going through? Muna, I'm there struggling. I've failed to complete this and this. How can you help me? feel free to open up. Even if someone goes out to discuss your issues, to talk about what you're going through, it is fine. You have opened up. Once you talk about something, at least you're going to come up with a meaningful solution. Instead of committing suicide, instead of getting addicted to drugs, instead of eating abnormally, sometimes you fail to eat, other times you eat too much, talk about it. You will get a solution. It contradicts with our culture, but for us, we are mental health helpers, and we are following the ethics. When someone opens up, you can even disclose other individuals who are going through the same challenges. And someone might say, oh, so I am not alone. So and so is also experiencing the same thing altogether. There is life after retake. There is life after HIV. There is life after losing a dear one. There is life after losing a job. There is life after any situation. It depends on how you compose yourself to adjust to that adversity. Are we together? And then the other thing, we need to greatly depend on social support. You have a counselor. How about other people in your environment? How do you find your relatives? How do you find your roommates? Do you have a spiritual leader who is helping you out? Do you have that best friend of yours who can help you get where you are? Why I am a psychologist now, I remember when I was in my final year here at campus, I was sleeping in Africa Hall. A friend of mine paid me a visit, and she was like, Mercy, you can make a very good counselor. It is my friend who spoke to me, and through her talk, I've tried to touch lives of very many people. Do you have time to go to church? Do you have time to go to the mosque? When you read the history of counseling, it started with Jesus Christ and the Holy Prophet Muhammad, peace be upon him. People used to go to them with many issues. They would go, open up, share their issues, and they were helped until it reached the great philosophers. Slowly by slowly, it reached USA, and now it is here in Uganda. We have great psychologists like all of you in this room. We have great psychologists like Dr. Jacinta, Professor Chibanja, Professor Chikoma, Professor Munene, many psychologists. So we have to deal with people in our environment. I know not everyone else is very good and very positive about our lives, but there is always that one individual who will keep you going. The other point, mind your nutrition. I know when we are very stressed, you've lost your dear ones, you've lost a job, maybe you've gotten a retake, you tend to become reckless with your life. You might start taking alcohol, eating chips every now and then, which is not healthy. To eat healthy, you don't need to have a lot of money. Take a glass of water in the morning. You can take a banana. If you cannot afford a banana in the morning, at least you take water. It is going to help you very much. But where we go wrong, we take the junk foods, especially the ladies. If someone does not take you to KFC, they are not helping you. But you're doing a disservice to yourself because it is not healthy. You can imagine something gets ready in oil. And the more oils you have in your body, the more the brain is going to be affected. Do good to others. It is very therapeutic. Give a helping hand. You listen. Psychologists like Martin Selman, they argue that part of what helps individuals to cope is contributed by our personality, 50%. But the 50% comes from the environment. That is, in case I do good to Rona or Adrian, they will also keep talking good about me. Just that compliment can keep you going, okay? It can keep you going. You can feel good. You've not injected in money, but just being good to someone Greet someone. You can send a hello message in the morning. How are you? Just follow up. I heard that you lost so and so. I'm sorry I didn't attend the burial. How are you feeling now? Just that, you people, it is very, very therapeutic. The other thing is about concentrate on everything good that you have. All of us, we have very many attributes. We have very many things. I was given 3 topics in one: coping, mindfulness, and self-care. But let me tell you, you cannot care for yourself if you don't know what is good with you. Do you know the best part on your body, or you don't know? Do you know what you like about yourself? Do you know that power engine of yourself? Is it the smile? Is it the eyes? Is it the nice figure? What is good about yourself, my dear? So I have something to say? You don't know. After here, you can come to me and I help you identify what is really good about you. Okay? All of us, we have very many good things about ourselves, but we don't know. Because the society will always pull you down. And we have no control over what people do to us and what they say about us. But do you know your strength? Do you have that inner strength in you? Do you really believe that you can make it? Or as people are pulling you down, you also concentrate on what they are telling you? Because if you know how good you are, there is no way you'll pay attention to what other people are telling you. Because they also have their motives. Maybe their purpose in life is to make people feel bad. And you, what is your purpose in life? Where do you see yourself? Okay? Do you have a goal in life? In spite of the many obstacles. Like when Rona told me about this summit, I had another symposium in the morning and I badly wanted to attend both of them. But I said, in spite of what happens, I have to show up at both summits. It started raining heavily. They told me about a sick relative. I said I have to show up. That's how we should all be, in spite of what you're going through. So long as you're still alive, my dear, continue to pursue your goal. Continue to wake up every morning, okay? If you're not dead, you will get whatever God has planned for you. I was admiring very many people when I was still a young girl, when I was still in high school. I would admire many people, but nowadays I'm like, Alhamdulillah, you see? Just pray to God to give you life. You will get there. One day, one time, you will get there. Because challenges will keep coming. People who came before us, when you read the holy books, the prophets of God faced most of the challenges. But for us, when you face one challenge, you're like, I'm going to drop out of the course. I'm divorcing this man. I am going to resign. Even before getting a new job, I am resigning. I will not put on this dress because your friend has said it looks ugly on you. But according to you, do you feel ugly or you feel great? If you feel great, go ahead and put on your dress. You will not impress everyone else. The other thing is about meditation. Do you have time to meditate? There is another psychologist called O'Sullivan or Laith. You can go to her YouTube channels and see her videos, what she says about meditation. Do you have time to sit and you think about yourself? Do you have time to sit and you appreciate what is going on in life? Are you mindful of everything else surrounding you, or you're not? Because as human beings, it really happens to us. We concentrate on what we don't have. We concentrate on the trauma we are experiencing. We concentrate on what is going on in our lives instead of looking at, at least God has taken me this far. I went through this. I lost my parents when I was in primary too, but I've managed to reach this far. I think I can also go through this challenge. My uncle contracted HIV when he was 17. He managed to see his children graduate. I think I can also make it. You get? If you keep telling yourself such things, you're going to get there, whether rain or sunshine. And then the other thing, we should also stop comparing ourselves to others. Different people have different destinies. And God has different timing for all of us. You get? You can compare yourself to someone who God planned that on such and such a day she's going to get 10 achievements in her life. I remember when we were leaving campus, we sat down. By 24 years, I should be a mother of 2. By this, I should have my own organization. By this age, I should have this. By this. But when you get there, you face the reality. You discover that you had set your priorities to be too high, and yet you don't have control over certain things. Are we together? And I don't want to overkeep you people here, but we have other techniques, although in one of the conferences, someone was telling me, but those ones do not work in our culture. But we, as intellectuals here, practice them. If you really feel depressed, can you start journaling? You write whatever you're going through, and you're like, oh God, this is not going to overshadow my objectives in this life. I know I'm experiencing this, but I can do better. I am a better person, and I am a very strong person. You can also carry out some physical activities, exercising. You don't have to run, you don't have to do it. You can just start with breathing exercises, okay? Breathe in and breathe out. I try it whenever I wake up in the morning and also when I'm going to bed. It has kept me going. Not that I don't have challenges. I have many, my dear. I have many challenges. But because of what we are talking about in this room right now, I am going on so well, okay? And like Elizabeth told you, I have many counselors. And for me, I am no longer shy to talk about what I'm going through. I know culturally people will discuss you. You see that person has rugambo. She's talking about this and this and this. But for you, you're healing, because mental illness is like pornography. It is like masturbation. They are silent killers. People cannot know that you're experiencing something until you break down. And we don't have to cope with only adversity, but sometimes you might get very many good things and they turn out to be overwhelming to you. At one time, I went to Mutabika Mental Referral Hospital to take a client of mine. And then as I was trying to see the doctor, someone shouted, Madame Mastula, Madame Mastula. I said, that one must be my student, because my students are the ones who call me Madame Mastula. I told the doctor, can you kindly follow up to see that person who knows my name? They brought the young man. He was like, you taught me child abuse and neglect. And shortly after our graduation, I got a job in some organization and I was promised 10 million. Since the day I got my appointment letter, I ran mad. That's why I'm here. So sometimes every situation might seem to be overwhelming. You really need to know how to cope with goodness and negativity. And some they talk about music. When you listen to music, it kind of relaxes your brain. It kind of helps you to forget, especially inspirational songs. So if you can buy yourself a robot. If you don't have, at least all of us in this room, we have a smartphone, and every smartphone has a radio. You can just play any music. You can even look for the music in your local language, and you play that music, so long as it applies to you very well. And keep telling yourself, keep speaking to yourself, no matter the case, I have to look good, I have to continue moving, okay? What is it that keeps you going? Is it looking good? Is it having your local meal? Is it hanging around with friends? Is it doing whatever? So long as it is not destructive, go ahead and do it. There are other things which you can think about, like self-talk, art therapy, when you do a lot of drawings, a lot of paintings, they also speak volumes. They can help you to cope. And lastly, but not least, you should always write a new script of your life. To go through what you're going through, it does not mean maybe you're cursed, like most people say, you're not blessed, or you're not doing good enough. No, that is God's plan, that you're going through what you're going through. My last point this evening is prayer. Why I put it last, I remember one of my former professors was like, what if someone does not like to pray? But prayer is very therapeutic. When you pray, I don't know how the magic behind prayer, but there is a way prayers will help us to heal, they help us to get better, they help us to go through challenges, because not that every time you'll have this person to talk to. Maybe the person is resting, maybe the person is out of the country. You've tried to call a toll-free line, but what can you do, you as an individual, okay? You can do some simple things that can help you to heal very well. Let me take this opportunity once again to thank the organizers of this conference, our keynote speaker, Dr. Nekesa Jacinta. You can wave because you've really mentored many psychologists in this country, and she's a very good, calm lady, very good listener, ever willing to help. I am so happy to be here this evening. Rona, thank you so much, and the Department of Psychology for choosing me to represent our department and Dr. Jacinta during this mental health summit. I beg to stop here for tonight.
Thank you very much. Thank you very much, Hajat Mastula, for your time and for ensuring that you got here despite all the hindrances of the day. Yes. It's been a pleasure having you. And for everybody who has been patient enough with us to stay till this time, we are really grateful. You can take your leave. Thank you. We're coming to the end of this summit. I would kindly like to request Mr. Henry Nsubuga to once again come up here and give us his closing remarks on behalf of the university and the Counseling and Guidance Center. Thank you very much.
I think the energy levels are still not so bad, but I'm just here for a short time. Thank you very much, everyone, and thank you very much, especially to Kule Foundation, and thank you very much, all the presenters. The presentations have been very wonderful, to an extent that even when I went, I was putting on my phone to listen to each and everyone who spoke, and it was wonderful. Thank you very much for all those who attended also. Can we give ourselves a big hand clap? It was so beautiful, and I think each one of us has gone away with something. One time when I was attending a conference in New York, it was a counseling conference, one of the presenters was talking about secrets. And when the presenter who has been here said she no longer keeps anything to herself, this presenter said, the fewer secrets you have, I want each one of us to look in their lives. The fewer secrets you have, the more peaceful you are. Just go and think about it. The fewer secrets you have, the more peaceful you are. And actually, the more peaceful you will die. If you don't have any secrets as you die, so you'll die a very peaceful person. They will see a person dying and they're just smiling because they are going to heaven. Yeah? Probably that's how it's going to be. So I must say, let's not keep these dark things to ourselves. The reason we have all these 5 fingers is each finger helps the other in some way. And so we are all here to help each other in some way. So we need to support each other. Let's be our brothers and sisters keepers. I think that's how we are going to promote a healthy world. Every year I talk to students. Even next week, our whole week is fully packed during orientation. But starting last year, I started talking about 3 things, and these are the things I'm going to be talking about. I would ask students I would tell students, why do we go for help? Especially, I would be talking about counseling because of 3 things, which I called the Trinity in some way. I said, number 1, tragedy. Just like they were saying, anytime tragedy sets in, as we are going out of here, you can break your leg. One time, one of my friends broke their leg at office. I'm not going to say who this person is. But they broke their leg, just tragedy, boom, the leg was no more. They had come in the morning, and actually Evelyn, who was here, she broke her leg. She just slid and the leg was broken. Tragedy sets in. It can set to anyone. So that means no one of us is immune to tragedy. Number 2, I told them, and I always tell them, that also we are growth-oriented human beings. We've been talking about purpose, we've been talking about all this. All of us want to improve. Actually, when we are talking about being proactive, not even waiting to go for counseling per se, studies are showing that if you give, say, psychoeducation workshop, out of every 60 people, only 6 people will need counseling. The rest will be okay because they will have the skills. So we are growth-oriented human beings. We want to improve every other day. If I'm struggling with the procrastination, I want to get out of that. If I'm struggling with the shyness, I want to get out of that. Each one of us want to improve. So none of us is completely done and doesn't want to improve. So because of that, you may still want to go and seek for help from someone else. The last bit is we have a wounded past sometimes. None of us is, for some reason, not wounded. As you were growing up, they said this guy has big cheeks. This guy from Karamoja was telling us that when he came here, everyone was looking at him and was like, who? You know, he didn't feel probably comfortable with being, and it could wound you actually. You were lucky you were not wounded. But for some could be wounded because of, say, what happens to them, the remarks people make. It could be about anything. So we could be wounded either accidentally or intentionally. People wound us, and all that may necessitate that you go and seek for help such that that woundedness doesn't affect you the rest of your life and probably affect the way you relate with yourself, but also the way you relate with other people. I really enjoyed today. People talked about their experiences, and it was so edifying. And I think as we move out of here, each one of us needs to go and build what we call a psychological community. That means that what Hajat here was talking about, you need to have people whom you can always lean on in case you have adversity or anything coming. Even when you're happy, that psychological community is always important for us. And I want to say thank you. I don't want to observe protocol. Our president, UC, has fully been here, seated. Everyone, people came from all. People were calling me. Some of them have been seated for. I think someone, she should be the accent didn't sound Ugandan. You must have been the one who was calling me. Where is this place? And here is the place. I think you have enjoyed. I'm the guy you were calling. I didn't show myself to you when you entered. But thank you very much, and let's carry the message around. All the organizers, did you see those young girls who are putting on white t-shirts? They've done a good job. Yesterday they were in Chikoni promoting mental health. That's beautiful. And you are going to get jobs. These guys have been seeing you. They have been seeing how much you are working. Opportunities are going to come your way. And they were saying, purpose, you do it even when they don't pay you. I know you have not been paid, but you are okay. And you are going to get, and you have done as well, yeah? Thank you once again to Kule Foundation for a beautiful work. And I want to thank my bosses, university management and staff, for giving us this space. We didn't pay for it. Yeah, for giving us this space, because if we were to pay for it, all these lights are taking taxpayers' money and students' money. So, yeah, they did a good job, and mental health is going to blossom. I'm very sure. This is not how we started. We are doing very well, and if we have partners like Tukule, we are going to do even greater. Thank you very much, and thank you everyone for listening to me and for gracing this occasion. Thank you.
Did I have to say anything more?
No, you
are closing.
Yes, sir. Thank you very much. All right. Thank you very much, Mr. Henry, for gracing us with your presence once more. It's always a pleasure. Madame Elizabeth, thank you for staying with us till now. Madame Lindsay, you've been literally with us since morning till now. Thank you so much for your patience. And everybody else has been here with us till the end of this session. We're really grateful, and I hope it's been impactful for all of you. And I hope from here we can tell the difference from when we're feeling stressed, anxious, depressed. And we also have learned a few coping skills, purposeful living, self-awareness, and a lot of every other thing that esteemed speakers talked about. Once again, on behalf of Tukule Foundation, thank you very much for staying with us. I'm sorry that you had to see this face a lot, but well, it's the best we had to offer. So thank you very much. I would like once again to thank our sponsors, the Office of the First Lady. We are grateful. We thank Rocket Health, AMREF, Skills Clinic, Uganda Counseling Association, Break Free, which is unfortunately not here, but we had a great representation from the honorable speaker herself, our keynote speaker, and One Hope, NBS, Reach a Hand, and every other person, and Safe Places. They've all stayed with us, and they were really very supportive to ensure that this finally happened. Once again, thank you very much for staying with us. And I really hope that from here we will learn how to make our mental health a priority, and we'll find, because there's a lot of spaces right now talking about mental health. So let's endeavor to find them out. And let's also, again, like how most of the speakers emphasized, let's learn to be each other's keeper. Let's learn to look out for our friends, our family, because some of us are in families with people who are going through a lot, but no one is attending to them. Not that they don't see it, but sometimes we don't know how to help. But then, luckily enough, that's why we have Uganda Counseling Association and every other organization around right now dealing with mental health, including Tukule Foundation. So kindly do reach out. We're here. And then we have other programs that will be coming up soon. This was our first mental health summit in the university. However, we hope it's not going to be the last. So we're going to be going to other public universities as we move on through the year. So kindly follow us on our social media handles, and our website is also going to be up soon. So always follow up to see what we're doing next and where we're doing it, and ensure to attend. And we hope that with the support of the new partners that have come on board, next time we shall be able to provide you with lunch. And we're very sorry about starving you today. I think that being said, once again, thank you for everything. For those who stayed, we're grateful. I would kindly like to request Reverend Nathan to give us a closing prayer, and then we shall let all of us get out of here, because I believe we're tired. Thank you very much, Reverend.